The soldier stopped breathing at 11:47 p.m., and nobody in that emergency room noticed. Not the charge nurse charting at her station. Not the residents arguing over a dosage calculation near the supply cart. Not the attending physician who was already 3 patients behind and running on his 4th cup of cold coffee. Nobody, except the woman they'd spent the last 6 hours treating like she was invisible. Rachel Hayes was mopping a patient's spill off the floor tiles when she heard it. Not a sound. The absence of one. A silence so specific, so wrong, that her body moved before her mind caught up. She dropped the mop. And everything that happened next would change that hospital forever. Before we go any further, if you're watching this for the first time, hit that subscribe button right now and turn on notifications, because we tell stories here that will keep you up at night in the best possible way. Hit the like button if you're already hooked, and drop a comment telling me what city and country you're watching from. I want to see exactly how far this story has traveled. Now, let's go back to that emergency room. The Garfield Voss Medical Center sat at the edge of Dunmore, Pennsylvania, in that particular stretch of city where old money and industrial decay had spent decades negotiating a truce. Neither side was winning. The building itself was a mismatched stack of renovations, a 1960s core wrapped in 1990s additions, and held together by a 2010s glass lobby that always leaked when it rained hard. It was not the hospital anyone chose. It was the hospital people ended up in. Rachel Hayes had been working the night shift there for 4 months, and she had spent most of that time being treated like furniture. She was 34 years old, white, brown-haired, and built lean in a way that read as unremarkable until you caught her moving. There was something in the economy of it, nothing wasted, nothing soft. She'd come to Garfield Voss through a placement agency, transferred from a smaller clinic in Vermont with minimal references and a resume that listed 6 years of employment in a category simply labeled Government Health Services. Nobody had asked follow-up questions. Night shift at a mid-tier trauma center in northeastern Pennsylvania was not exactly attracting the deep scrutiny of the credentialing committee. She reported to the charge nurse, a veteran named Donna Purcell, who was professional, overworked, and too tired to be unkind, which was the closest thing to warmth you got on nights at Garfield Voss. Donna kept Rachel stocked with assignments and left her alone, which suited Rachel fine. The problem was Dr. Victor Sloan. Sloan was the trauma attending on nights, 47 years old, trained at Penn, and in love with the fact that everyone knew it. He had the jaw of someone who'd played lacrosse in college, and the manner of someone still annoyed the sport hadn't made him more famous. He was competent. Rachel had watched him work and would give him that. But competence in his hands had curdled into something uglier, the kind of confidence that needs an audience to feel real. He had noticed Rachel Hayes in her first week. Not in any useful way. Sloan noticed her the way certain men notice women who don't react to them correctly, with the faint, chronic irritation of someone whose existence has gone unacknowledged. She didn't laugh at his jokes in the break room. She didn't ask him questions she already knew the answer to. She just worked, quietly and efficiently, and something about that had apparently annoyed him into a low-grade campaign of professional diminishment that he would have called high standards if anyone had asked him to account for it. He corrected her in front of patients. He questioned supplies she'd already confirmed. Twice in her first 2 weeks, he'd called her by the wrong name. Rachel, delivered with the slight pause that made clear it was a choice. And when she didn't react, he'd escalated to a kind of performative skepticism, explaining basic procedures to her in front of junior staff with the elaborate patience of a man who had convinced himself he was being helpful. It was Tuesday night, 3 weeks into November, and the ER was running at that particular pitch of controlled chaos that meant everyone was 2 patients behind and 1 equipment failure from losing the thread entirely. A multi-car accident on I-81 had sent 6 people through the doors in 40 minutes, and the department was absorbing the shock of it the way it always did, by stretching everyone slightly past the point of comfortable function and hoping nothing else came through the door. Rachel was in Bay 4 with a 40-year-old woman who had a dislocated shoulder and a concussion, monitoring neurochecks and waiting on imaging results, when Donna waved her toward the trauma bay. "Sloan needs another pair of hands. Go." She went. The trauma bay was loud. 2 nurses, a tech, a resident named Dr. Farida Osei, who was new enough that she still flinched at the sound of the monitors. Sloan was working a construction worker named Gail, who'd taken a steel beam across the ribs and presented with a pneumothorax that Sloane had just finished draining. Rachel stepped in beside the resident and began anticipating, laying out a chest tube tray, checking the suction, noting the blood pressure trending slightly lower than she liked. "Nobody asked you for that," Sloane said, without looking up. "BP's dropping." "I can read a monitor." Rachel said nothing. She set the tray where it would be useful anyway and stepped back. Sloane glanced at her, then at the tray, then at the monitor. His jaw tightened slightly. The BP dipped another 4 points. "Start a second large-bore IV," he said to Osei, as if the idea had occurred to him independently. Rachel had the line ready before Osei finished reaching for a kit. Sloane's eyes flicked to her. There was something in them. Not gratitude, not acknowledgement, just the specific flicker of a man recalibrating his annoyance. He turned back to the patient. "Hayes." He said it with that half-second wait. "You worked at a community clinic before this, correct?" "Yes." "Ever seen a tension pneumo outside a simulation?" "Yes." He waited, clearly expecting her to elaborate. She didn't. "Right." He turned to Osei. "Community nurses sometimes confuse proactive with overreaching. There's a difference between clinical instinct and anxiety presenting as initiative. Something to watch for." He wasn't talking to Osei. He was talking at Rachel, through Osei, with the elegant cowardice of someone who wanted to land a blow without the mess of direct confrontation. Osei glanced at Rachel with an expression that was equal parts sympathy and the survival instinct of someone who knew better than to visibly take sides. Rachel met Osei's eyes for 1 second and let it pass. They stabilized the construction worker. Rachel finished her charting, returned to Bay 4, completed the neurocheck, flagged the imaging results for the attending on rotation, and went back to her other patients. She did not think about Sloane. She had spent 6 years learning how to not think about things that couldn't be fixed in the moment, and that skill transferred more cleanly to nursing than almost anything else from her previous life. The patient came in at 11:31 p.m. He arrived by private transport, which was the first unusual thing. Not an ambulance, a black Chevy Suburban with government plates that pulled up to the ambulance bay and disgorged 2 men in tactical clothing who were carrying a third man between them. The third man was large, maybe 6'2", built like someone whose job required it, wearing civilian clothes that were soaked through with blood on the left side from somewhere below the rib cage. The 2 men who carried him were not panicking. That was the second unusual thing. Most people who drag a bleeding friend into an emergency room at 11:30 at night are panicking at least a little. These 2 were not. They were scanning the room with the particular quality of attention that Rachel recognized from a context she'd spent 4 months trying to leave behind. Their eyes didn't move the way civilians' eyes moved. They checked exits. They noted personnel. They moved with the kind of deliberate calm that meant the adrenaline was there but was being managed as a resource rather than experienced as a feeling. Donna intercepted them at the desk. "What happened?" "Training accident," said the taller of the 2. He had a short beard and a Pennsylvania driver's license he produced immediately when asked, which told Rachel he'd anticipated the question and prepared the answer in advance. He took a fall. Possible internal injuries. The name on the intake sheet was Marcus Deal. Rachel noted it without comment. They moved him to Bay 7, which was the trauma bay furthest from the entrance, a corner position. Rachel noticed that one of the men positioned himself near the door without being asked. Sloane took the case, examined Deal efficiently, ordered imaging, and decided on a watch-and-wait approach for the internal bleeding, which was defensible, Rachel thought, if the BP held. She wasn't assigned to Bay 7. She was assigned to a 40-minute suture job in Bay 2 with a teenager who'd put his hand through a window, and then to a chest pain evaluation in Bay 5, and then to 3 other patients in the cascade of a busy night that kept reshuffling priorities. She was aware of Bay 7 the way she was always peripherally aware of things that didn't fully add up. Not actively. Just a background frequency, like a radio station playing in another room. At 11:44, she was passing the bay on her way back from imaging with a patient file when she glanced through the gap in the curtain. Marcus Deal's chest wasn't moving right. It was subtle. The kind of thing that wouldn't trigger an alarm because his SpO2 hadn't dropped yet, because the monitor was measuring what was already in his blood and the body was still compensating, burning through reserves. But the rhythm of his breathing had changed, too shallow, the interval between breaths fractionally wrong. Rachel stopped. She looked through the gap for 3 seconds. She counted the breaths. She looked at the waveform on the monitor screen visible from the doorway. She noted the slight change in coloring at his nail beds that was barely perceptible under the fluorescent light, and that she would not have been able to articulate how she'd noticed. Her body made the decision before her professional calculus finished running. She pushed through the curtain. The Bay 7 nurse was a man named Pete Grabowski, solid and experienced, currently charting with his back half turned to the patient. He looked up, startled. "Hayes, you're not—" "He's obstructing." She was already at the bedside, already repositioning Deal's head, already running her hands along his neck. "Partial. He's been compensating. Get Sloan." "His sats are fine." "Pete." Her voice had a quality in it that she didn't use often. Not loud, not aggressive, just absolutely certain in a way that cut through procedural objection. "Get Sloan now." Pete looked at the monitor, looked at the patient, looked at Rachel. Something in the way she was standing at that bedside, the posture of someone for whom urgency and stillness were not opposites, made him move. She worked while Pete went. The obstruction was soft tissue, exacerbated by Deal's position and the inflammation from his thoracic injury pressing in unexpected directions. She repositioned him, deployed a nasopharyngeal airway with the efficiency of someone who had done it in conditions considerably worse than this, and kept her fingers on his pulse while she tracked his color and counted. Deal's breathing changed. His chest found its rhythm again. His nail beds came back from gray. His oxygen saturation, which had finally begun its delayed drop, reversed course and climbed. Sloan came in 30 seconds later, already wearing the expression of a man whose time was being wasted. He saw the NPA. He saw the patient's color. He looked at the monitor, where the numbers were now clean and stable, and he stood in the doorway for a moment, assembling an appropriate response. "I didn't authorize a nasopharyngeal," he said. "He was obstructing." His SATs were in range. They were about to drop off a cliff. Rachel stepped back from the bedside. Delayed compensation. He was burning through reserve. Another 4 minutes without intervention. "You are not assigned to this bay." Sloan's voice had gone flat in the way that meant he was genuinely angry rather than performatively irritated. "You inserted an airway device on a patient outside your assignment without physician authorization." "I inserted an airway device on a patient who was about to code." The two men in tactical clothing were both in the room now. Rachel hadn't heard them come in. The taller one, the one with the beard, who had given his name as Nathan, was watching her with an expression that was difficult to read. Not alarmed. Something else. Sloan pointed at the door. "You're done for the night. We'll discuss your conduct with administration in the morning." "Victor," Pete started. "Done." Sloan looked at Pete, then back at Rachel. "Effective immediately." Rachel looked at Marcus Deal. His chest was rising and falling with the steady reliability of a man who was going to be fine. His color was good. His monitor was clean. She looked at Sloan. "He wasn't breathing," she said. "Now he is." She left the bay. In the hallway, she walked to the nurse's station, set down the file she was still carrying, and stood for a moment with her hands flat on the desk. Her pulse was elevated. She noted it the way she noted most things about herself, as information, not experience. She breathed through it with the particular discipline of someone who had learned that feelings were real, but timing was everything. Donna appeared at her elbow. "What happened?" "Sloan's sending me home." "I heard. Rachel." "He's not wrong about the protocol." Rachel picked up her jacket from the hook behind the station. "I went into a bay I wasn't assigned to and performed a procedure without authorization. That's a legitimate conduct issue. The patient is fine." She pulled the jacket on, "which is the only part that matters." Donna stared at her. "You're not even going to fight it?" Rachel considered the question seriously, which Donna seemed not to have expected. "There's nothing to fight yet. Let them write it up. We'll see what it says." She walked toward the exit. Behind her, she could hear, faintly, the sound of the bay curtain moving, and then the voice of the man named Nathan, carrying the particular quiet of someone accustomed to being heard without raising his voice, saying something she couldn't fully make out. But she heard 3 words clearly. "Who is she?" She pushed through the exit door and out into the cold November parking lot, where the wind was coming off the hills and the sky above Dunmore was the specific deep charcoal of a cloudy night with no stars visible, and she stood next to her 12-year-old Honda and took a breath of air that tasted like winter. Her hands were steady. They were always steady. That was the thing she'd never been able to unlearn, no matter how far she ran from the person who'd learned it. The hand stayed steady. The assessment ran clean. The body knew what to do because the body had done it in places and under conditions that she did not think about on purpose, had spent considerable effort not thinking about, had moved 800 miles and changed her whole life trying to stop thinking about. And tonight, in a fluorescent-lit trauma bay in northeastern Pennsylvania, her hands had simply done what they knew how to do. She got in the car. She sat there for a moment in the quiet. Then her phone buzzed on the passenger seat, and she looked at the screen. Unknown number. Pennsylvania area code she didn't recognize. She stared at it through 2 full rings, and then, with the resignation of someone who had suspected this was not over, she answered. The voice on the other end was Nathan's. Ms. Hayes. Not a question, not a greeting, exactly. Just her name, delivered with the same quality of unhurried certainty that she'd heard in the bay. I think we should talk. Rachel looked at the hospital entrance through her windshield, where the fluorescent light spilled yellow onto the wet November asphalt. I think, she said carefully, that depends on what you want to talk about. There was a pause. My name is Commander Nathan Cole, he said, and the man you just saved is not who his intake form says he is. The silence on her end of the phone lasted exactly 4 seconds. Rachel knew because she counted them, an old habit, the kind that doesn't dissolve no matter how many years of civilian life you stack on top of it. 4 seconds of silence while she processed what Nathan Cole had just said, while she looked at the yellow spill of hospital light on wet asphalt and made a quick, quiet decision about how much she was willing to give away in the next 30 seconds. I'm listening, she said, not on the phone. His voice was even, unhurried, the voice of a man who'd had sensitive conversations in difficult circumstances before, and had developed the patience for doing them correctly. There's a diner on Callaway Street, 2 blocks north of the hospital. Can you be there in 10 minutes? Rachel looked at her steering wheel. She thought about saying no. She thought about driving home to her apartment on Keswick Road, making tea, and going to bed like a person who had learned to leave certain things behind. 15, she said. I need to stop for gas. She didn't need to stop for gas. She needed 12 minutes to think, and she needed 3 minutes to make sure nobody was following her out of that parking lot. Old habits. The diner was called Millie's, and it had the particular quality of a place that had been open since 1978 and intended to outlast every trend that had ever threatened it. Vinyl booths the color of dried mustard, a pie case with hand-lettered signs, coffee served in cups that were thick enough to survive a drop onto a tile floor. It was nearly empty at this hour, a lone trucker at the counter and a teenage couple in the far booth splitting a plate of fries with the focused intensity of people who had nowhere else to be. Nathan Cole was already there. He was in a booth near the back, facing the door, which told Rachel he'd chosen the seat and not just taken what was available. The second man, shorter, with the compact coiled build of someone who spent serious time on climbing walls or rope courses, sat beside him, positioned slightly outward from the table in the way that meant he was tracking the room. Rachel slid into the opposite bench. A waitress appeared and Rachel ordered coffee without looking at the menu. When the waitress left, she looked at Nathan Cole directly and waited. He was, she estimated, early 40s. Close-cropped hair going gray at the temples, the kind of face that had spent significant time in weather and carried the evidence. He had the stillness of a person who was comfortable with silence, which meant he was either very patient or very experienced at reading the value of it. Probably both. The man you treated tonight, Nathan said. His name isn't Marcus Deal. I know. That landed. Both men registered it. A fractional shift in posture, the slight recalibration of people who had just been told the conversation was not going to go the way they'd mapped it. You know, the second man repeated, the intake form was filled out too fast for someone making up a real story. The name was generic, 2 common syllables, nothing memorable, and the address listed was a commercial block in Scranton that I happened to know because I drove past it last month. Rachel wrapped both hands around her coffee mug. He's military. Special operations, probably, based on the physical profile and the way you two move. And whatever happened to him wasn't a training accident, because training accidents produce different kinds of bruising, and his pattern is consistent with a controlled fall during active exfiltration. Nathan looked at her for a long moment. Who are you? He said. It was the same question she'd heard him ask, faintly, as she'd walked out of the bay. Hearing it again, directed at her, with all his attention behind it, was a different sensation than overhearing it from a parking lot. "Rachel Hayes," she said, "night shift nurse, Garfield Voss Medical Center." Before that, she drank her coffee. It was bad coffee, but it was hot. "Before that, I worked government health services." "That's what your resume says." "Then you already have the answer to your question." Nathan leaned forward slightly. Not aggressively, more like a man closing unnecessary distance. "The reason I'm asking, Ms. Hayes, is that what you did in that bay tonight was not civilian trained. I've worked alongside combat medics for 16 years. I know what that looks like. The way you assessed his airway from a doorway. The way you deployed that NPA in under 40 seconds with a patient who was starting to move." He paused. "You didn't ask for gloves. You already had them." She had. She'd pocketed a pair in the hallway, 14 seconds before she entered the bay, because some part of her had already decided she was going in before her conscious mind had finished the argument. "I'm thorough," she said. "You're something," Nathan said, and the way he said it wasn't a compliment or a challenge. It was more like a conclusion reached after evidence review. "The man in Bay 7 is Sergeant First Class Damon Veris. He's attached to a task force I can't name in a place I can't specify, and he is currently the primary witness in an ongoing federal investigation. He was supposed to be transported to a secure medical facility in Virginia tonight. The transport window closed when he collapsed." Rachel set down her mug. "How bad is the internal bleeding?" The attending said, "Watch and wait." "I know what Sloan said." She looked at Nathan steadily. "How bad is it actually?" Nathan glanced at the second man. Something passed between them, the kind of wordless exchange that required a shared shorthand developed over years. "He took a hit 2 days ago," Nathan said. "We managed it in the field. It held until about 6 hours ago. The physician's assessment is consistent with what we were told before transport. Manageable, short-term, but he cannot be moved tonight." "Which means he's in that hospital," Rachel said, "in a bay with a door that faces the main corridor, under a false name, with a security presence that consists of you and—" She looked at the second man. "What's your name?" "Bryce," he said, and nothing else. "You and Bryce." She looked back at Nathan. "What is it you think I can do about that?" "Right now, nothing. We have people coming in from Philadelphia. They'll be here by 0400. We just need the patient to stay stable until then." He leaned back slightly. "But you know something's wrong with his condition that the attending doesn't. And the attending just sent you home." Rachel looked at the pie case across the diner. Lemon meringue. Cherry. Something that might have been peach. The hand-lettered sign said "All pies baked fresh," and the handwriting was very bad. "Why not go over Sloan's head?" she asked. "Tell the chief of medicine you need a second opinion." At 12:30 a.m., with a patient under a false name, in a hospital that has no security clearance and no established protocol for this situation, Nathan's mouth did something that was not quite a smile. That conversation goes sideways very fast. So does this one. She pulled on her jacket. "I was sent home. If I go back in that building tonight, Sloan has grounds to escalate the conduct complaint to a suspension or a license issue." She stood. "I can't help a patient I'm not authorized to see." We're not asking you to go back in," Nathan said quickly. "We're asking for information. If there's something Sloan missed, something you saw that changes the picture, we need to know what to tell the physicians in Philadelphia." Rachel stood at the edge booth for a moment. The trucker at the counter asked for a refill. The teenage couple laughed at something on a phone screen, a brief bright sound in the quiet diner. "Positional airway compromise from thoracic inflammation," she said. "If the internal bleeding is lower abdominal and the swelling is tracking upward, it can push against the diaphragm in ways that don't show on a standard assessment until the patient is already in trouble. His NPA will help short term, but if he's flat on that bed all night, it's going to happen again." She put on her jacket. "He needs 30-degree elevation, left, lateral tilt, and someone checking his airway status every 20 minutes. Not his SATs, his actual airway mechanics. There's a difference." She dropped a $5 bill on the table for the coffee. "Tell your people in Philadelphia," she said. "Tell them what to look for." She walked out of Millie's into the cold. She drove home. She made tea. She sat at her kitchen table in the apartment that she had furnished with the minimum required to make a space functional. A table, 2 chairs, A couch she'd bought secondhand, bookshelves that held mostly medical references, and 3 years of accumulated paperwork from a previous life she'd carefully never thrown away. She did not sleep. The suspension notice arrived by email at 7:14 a.m. It was formal, efficiently written, and signed by Dr. Harlan Drummond, Chief of Medical Staff, who had clearly been briefed by Sloan before the sun came up. The language was careful: unauthorized clinical intervention, conduct inconsistent with departmental protocol, pending administrative review. But the substance was clear enough. She was off the schedule indefinitely. Her access card had been deactivated. She was to have no patient contact until the review was completed, which could take up to 30 days. Rachel read it twice. She drank her tea. She opened her laptop and looked at her bank account, which had enough in it to cover 3 months without income if she was careful, and she was always careful. Then she read the email a third time and noticed something Drummond probably hadn't intended to make visible: the timestamp on the original complaint, which Sloan had filed at 1:08 a.m., less than 90 minutes after she'd left the building. He had gone home, presumably, or stayed in the hospital, and at 1:08 in the morning he had sat down and written a formal complaint about a nurse who had saved a patient's life, because the alternative, acknowledging that she'd seen something he'd missed, was a thing his particular kind of ego could not metabolize. She felt something that was not quite anger. It was a colder thing. The kind of clarity that comes when you've been given information about exactly who you're dealing with. She called the state nursing board's general information line, sat on hold for 11 minutes, and confirmed the process for responding to a conduct complaint filed by a supervising physician. Then she called a legal aid clinic in Scranton that handled employment cases and left a message for a callback. She was not going to disappear quietly. She had done that once already. It had taken 6 years, a relocation, and a complete reconstruction of her professional identity, and she was not doing it again over Victor Sloan's bruised sense of authority. At 10:30 that morning, Donna Purcell called her. "I heard," Rachel said before Donna could start. "The whole floor heard." Donna's voice had the particular quality of a woman who was furious and trying to express it in the 5-minute window before someone noticed she was on a personal call. "Victor filed it at 1 in the morning, Rachel. 1 in the morning." "I know." "The patient you treated is fine, for what it's worth," Pete told me. "He's stable, they moved him to a private room, and there were federal agents in the corridor at 6 a.m. when I came in for handoff." Rachel straightened slightly. "Federal agents." "2 of them. Suits, credentials, the whole thing. Nobody's saying who they are or why they're here." Drummond looked like he hadn't slept. "And Victor?" Donna paused. "Victor has been in his office with the door closed since 8. Rachel turned that over. The Philadelphia people must have arrived. Or something else had arrived. Something that had made the climate in that hospital shift perceptibly overnight. Enough that a chief of medicine who'd sent a suspension notice at 7 a.m. was now visibly rattled. "Donna," she said carefully, "did anyone say anything about the patient in the private room? Name, condition, anything?" "No, and his room has a posted guard now. An actual guard, not a security volunteer, someone with a sidearm." Donna dropped her voice. "What did you walk into last night, Rachel?" "I'm not sure yet," Rachel said, and that was honestly true. She hung up and sat very still at her kitchen table. Then she called the number Nathan Cole had called her from the previous night. It rang 4 times. She expected voicemail. Instead, "Cole. It's Hayes." She kept her voice level. "You have federal agents in the hospital. I assume that's your Philadelphia people. They arrived at 3:30. Varus is stable. Your recommendations helped. I want to know what's happening." "Ms. Hayes, I'm suspended from my job," she said, "because I went into a bay I wasn't assigned to and saved your operative's life. I think that buys me a conversation." The pause was shorter than she expected. "Come to the hospital," Nathan said. "Not the main entrance. There's a service entrance on the east side loading dock. I'll have someone meet you." Rachel looked at the suspension email still open on her laptop. "My access card's been deactivated," she said. "I know," Nathan said. "You won't need it." Well, the loading dock smelled like industrial cleaning products and the specific cold of Pennsylvania in November that had settled into concrete and refused to leave. Bryce was waiting, in the same tactical clothing from the night before, with the addition of a fleece jacket that somehow made him look more dangerous, not less. He nodded at her when she arrived and led her inside without a word. through service corridors she hadn't known existed, and up a freight elevator that groaned on its cable. They came out on the third floor, which Rachel knew from her months at Garfield Voss as the floor where private rooms were located. Surgical recovery, some long-term monitoring cases, the rooms that got fresh paint more than once a decade. The corridor outside room 318 had two men in it who were definitely not hospital security, and they tracked Rachel's approach with the careful, evaluating attention of people whose job was to make decisions quickly about strangers. Nathan was inside the room, standing near the window. Damon Veris was sitting up in bed at 30 degrees, left lateral tilt, exactly as she'd specified. He was awake. He was a man who, she now saw in full light, was somewhere in his late 30s, with the kind of face that had been handsome before whatever had happened to it in the field. A jaw set at an angle that suggested he'd broken it at some point, and it had healed slightly wrong. He looked at her with the particular expression of a patient who had been told he nearly died and wasn't entirely sure how to feel about the person who'd prevented it. "You're the nurse," he said. "Yes." "They tell me you're suspended." "Yes." He nodded, as if this confirmed something. "I've known a few medics who got burned protecting people who didn't deserve protecting." He looked at Nathan. "You gonna fix that?" "Working on it," Nathan said. Rachel pulled a chair to the side of the bed with the clinical efficiency of someone who was at a bedside regardless of what her access card said. She checked the elevation. She looked at his color. She looked at his respiratory pattern. "Still getting some positional resistance," she said. "You feeling any pressure when you breathe in deep?" "Some." "On the left?" He considered. "Yeah." "Okay." She looked at Nathan. "What do you actually need from me right now? Because I didn't come here to be thanked." Nathan crossed his arms. He looked for the first time like a man who was choosing his words because the wrong ones had consequences. "The federal agents downstairs are not here about Veris, or not only about Veris." He paused. 2 hours ago, we received intelligence that the people who attacked the transport that put Veris here last night have local assets, in or near Dunmore." The room was very quiet. "How local?" Rachel asked. "We don't know. We're working to find out." Nathan looked at her steadily. "What we do know is that Veres needs to stay in this hospital for a minimum of 48 hours before he can be safely moved. And whoever came after the transport last night knows we didn't make it to the secure facility, which means they know he's somewhere in this city." Rachel thought about the layout of Garfield Voss, the corridors she knew from 4 months of night shifts, the service routes she'd just walked in through, the entry points, the staffing patterns at different hours. She thought about it the way she hadn't thought about a physical space in 6 years, with the specific structured attention of someone calculating vectors of vulnerability. "Your people outside this room," she said. "How many entry points are they covering?" "Main corridor, the elevator bank, and the stairwell exit. There's a laundry service corridor on the east side of this floor. It connects to a freight access on the second floor that opens to the parking structure." She looked at him. "It's not on the main hospital map. It was added in the 2009 renovation when they expanded the West Wing and they rerouted the service access. Most of the staff doesn't know about it." Nathan was already on his radio. She watched him relay the information to someone, heard the acknowledgement come back, and observed the slight recalibration that happened in the room as the security picture adjusted. Bryce disappeared into the corridor without being asked. Veris was looking at her. "Who are you?" he said. Not the same question Sloane asked it, not Nathan's professional inquiry. Something different, quieter, more direct. The question of a man who had spent enough time in dangerous places to recognize when he was looking at someone who had too. Rachel picked up his chart from the bedside. She checked his last vitals. She adjusted his pillow 2 centimeters to improve the lateral positioning and noted the small intake of breath he took as the pressure shifted. "I'm the person making sure you don't obstruct again," she said. She sat down in the chair she'd pulled to his bedside and stayed there, and said nothing more, and neither did he. 3 hours passed. Nathan came and went. The federal agents, 2 of them, a man named Agent Prescott and a woman who introduced herself only as Carver, came in at 1 p.m. and asked Rachel a series of questions about the previous night's events that were more detailed than she'd expected and covered things she hadn't realized anyone had observed. They had a transcript of the conversation in the diner. She wondered how, then stopped wondering because it didn't change anything. She answered every question directly and without embellishment, which seemed to surprise Carver, who had the interview style of someone accustomed to people managing their answers. You inserted the NPA before you alerted the assigned physician, Carver said. Why? Because the patient needed the airway before he needed the physician. Hospital protocol. Hospital protocol assumes a timely response window that didn't exist, Rachel said. He had approximately 90 seconds before desaturation. The protocol is written for a different set of circumstances. How did you know he had 90 seconds? Rachel looked at her. Experience. Carver wrote something in her notebook, and whatever it was, she underlined it. At 3:15, the complaint from Sloan landed differently than Rachel expected. She was in the corridor outside room 318. She'd stepped out to give Veres a rest interval and to eat half a granola bar she'd found in her jacket pocket because she'd missed both breakfast and lunch when her phone rang again. Not Nathan this time. The number was blocked. She answered. Ms. Hayes. The voice was male, administrative, carefully neutral in the way of someone reading from a script they'd practiced. This is the office of Dr. Harlan Drummond. We've been made aware that you are currently in this facility, despite the suspension of your access credentials. We're asking you to vacate the premises immediately, or we will be compelled to involve hospital security. Rachel looked down the corridor at the two federal agents outside room 300. Tate, I'm here at the request of law enforcement, she said. A pause. We have no record of... Agent Prescott from the Philadelphia field office can confirm it, she said. He's 30 feet from where I'm standing. Another pause, longer. We'll need to verify that, the voice said. Take your time, Rachel said, and hung up. She ate the rest of the granola bar. It tasted like cardboard and almonds, and she ate it without complaint because she had eaten considerably worse things in worse places and under more complicated circumstances. At 4:45 p.m., Victor Sloan walked onto the third floor. She heard him before she saw him, his voice carrying from the elevator bank, the particular projection of a man who had decided to handle something personally and had convinced himself this was about principle. She moved to a position near the corridor junction where she could see him without being immediately visible, an old instinct that she made no effort to suppress. He was with Drummond, who looked like a man being escorted to his own firing, pale and careful-footed. They were walking toward room 318, and Sloan was talking. She caught fragments: patient welfare, unauthorized presence, liability exposure, with the fluency of someone who had prepared their argument during the walk from the elevator. They stopped in front of the room. The federal agent outside the door, Prescott's colleague, a younger man named Torres, looked at them with polite, absolute disinterest. This patient is under federal jurisdiction, Torres said, before either of them could speak. Sloan's jaw tightened. This is a hospital, not a federal facility. Yes, sir. And the patient in this room is under federal protective jurisdiction, which supersedes local hospital administrative authority in matters concerning his care and the personnel authorized to provide it. Torres looked at Drummond. Dr. Drummond, we sent a communication to your administrative office at 2 p.m. regarding the authorization status of Rachel Hayes as a consulting medical professional for this case. Did you receive it? Drummond looked like he was doing math that wasn't adding up. We received a communication, yes, but then you have the relevant information. Torres turned back to the door. Gentlemen. Rachel watched Sloan's face from the corridor junction. It was a complicated face to watch in that moment, a face reorganizing itself around a reality it had not anticipated, the specific discomfort of a man whose authority has just been declined by someone with more of it, and who cannot identify, in this particular geography, a higher level to appeal to. He turned and scanned the corridor. His eyes found her. She didn't move. She didn't change her expression. She stood at the corridor junction with her jacket on and her granola bar wrapper in her pocket, and looked at Victor Sloan with the steady patience of someone who had been waiting a long time for the room to stop pretending she wasn't in it. He said nothing. He turned and walked back toward the elevator. Drummond hesitated, looked at Rachel, looked at Torres, and followed. Nathan materialized from somewhere down the corridor, appearing at Rachel's elbow with the quiet of someone who'd been positioned to watch the interaction. That's going to get more complicated before it gets simpler, Rachel said. Probably, Nathan agreed. He was looking at the elevator bank, jaw set. There's something else. She waited. We picked up communications in the last hour. Local cell traffic, coded. Our analysts are working on it. but the pattern is consistent with surveillance coordination. He looked at her. Someone is watching this building, and whoever it is, they've been watching it since before we arrived last night. The fluorescent light in the corridor buzzed faintly overhead. Somewhere down the hall, a monitor alarmed briefly, and then went quiet. They already know where he is, Rachel said. Nathan's expression was answer enough. Down the corridor, the door to room 318 opened and Varys appeared in the frame, one hand on the door jamb, ignoring the protests of the duty nurse behind him, scanning the corridor with the focused gaze of a man who'd just heard something he wasn't supposed to and was making his own assessment of what it meant. He looked at Rachel. He looked at Nathan. "Tell me," he said, "exactly what we're dealing with." And before Nathan could answer, Rachel's phone buzzed in her pocket. The unknown number again, the blocked one. And when she looked at the screen this time, there was no call. Only a text. 4 words. "We know she's there." Rachel stared at the 4 words on her screen for exactly 2 seconds. Then she turned to Nathan. "Pull your people in, now. Whoever's outside the building, they're not observing anymore." Nathan already had his radio up. The next 40 seconds were organized chaos. The kind that looks like panic from the outside, but is actually a system activating, each component finding its position. Taurus was on his comms. Bryce materialized from the stairwell exit like he'd been waiting for the signal. Varys, still gripping the doorframe, read the room with the speed of a man whose survival had depended on doing exactly that for the better part of a decade, and stepped back inside without being told. Rachel followed him in, pulled the door shut, and went immediately to the window. 3rd floor. East-facing. The parking structure across the service road was a 4-level concrete stack, and from her angle she could see the 2nd level. Open air, a dozen vehicles, a pedestrian walkway that connected to the hospital's east wing through a covered bridge that nobody used after business hours, because the bridge access required a keycard that most staff had stopped carrying years ago. Except the laundry corridor she'd told Nathan about connected to that bridge from the inside. "Nathan." She didn't turn from the window. "The service corridor on this floor, the one I told you about. Does your team have eyes on it right now?" She heard him confirm with Taurus. Heard the answer come back. "Negative," Nathan said, and his voice had shifted into the flat, precise register of a man operating. Someone with access to the hospital layout could come through the parking structure, across the covered bridge, and into the laundry corridor without passing any of your external positions. She turned from the window. "They sent that text to tell me they know I'm here, which means they've been watching long enough to identify me specifically, which means someone gave them information about who's in this building." Varys was back in bed, not because he wanted to be, but because Rachel had looked at him in a way that communicated clearly that him collapsing in a corridor was not a variable she was interested in managing right now. He had the pillow adjusted himself, left lateral tilt, which told her he'd paid attention to every instruction she'd given. "Internal source," he said, "or someone with access to hospital staff records. My suspension was filed this morning. Anyone who pulled the incident report from last night would know my name and why I was here." She looked at Nathan. "How many people know Varys is in this room?" "My team, the federal agents, the duty nurse, the attending on rotation, and Drummond." "Sloan?" she asked. Nathan paused. "He was on the floor." "He was at this door 20 minutes ago," Rachel said. "He heard Torres confirm federal jurisdiction. He knows this room has a protected patient. He doesn't know who or why, but he knows enough to have told someone." She picked up her jacket. "I'm not saying it's Sloan. I'm saying he's angry enough to have made a call to someone he thought was an ally and said more than he should have." Nathan was already moving. The next 8 minutes were the clearest 8 minutes Rachel had experienced in 4 years. She helped Torres reposition. She knew the 3rd floor, knew which supply closets had sightlines to the corridor junction, knew that the nurse's station had a monitor showing every room's door sensor on that floor, that nobody ever watched because it was calibrated for patient elopement prevention rather than security. She pulled up the sensor display, oriented Torres to it in 90 seconds, and showed him the laundry corridor access point on the physical map. She pulled from a laminated emergency procedure sheet mounted inside the supply closet door. Then she went back to Varys. Because whatever was about to happen, he was the reason it was happening, and he was the one variable she could actually control. His airway mechanics were still showing that mild positional resistance on the left. She checked manually, fingers at the trachea, listening to the breath pattern, watching the intercostal movement. Not critical. Manageable. But if he had to move fast in the next hour, if his heart rate spiked and his breathing volume increased with exertion, the compromise could tip over. "I need you to stay calm," she said. "I'm calm. You're running at about 80% of normal respiratory capacity right now. If your rate climbs above 22 breaths per minute, you're going to start working harder for less oxygen and you'll fatigue fast." She looked at him directly. "If something happens in this room tonight and you think you need to get up and help, don't. Let them do their jobs. Your job right now is to still be breathing when this is over." He looked at her with the expression of a man who is accustomed to being the one giving that speech, not receiving it. "Understood," he said, and she believed him. Well, the attack came at 6:22 p.m., not through the laundry corridor. That was the thing about people who had planned an operation. They planned contingencies, and when the obvious route was covered, they took the one that wasn't. They came through the hospital's internal maintenance access, a series of utility tunnels connecting the building's mechanical systems that were on no public-facing map and required physical keys rather than electronic access. Someone had the keys. Whether they'd obtained them through the internal source or through preparation that had started before any of them had arrived was a question for a different time. Rachel heard it first as a change in the building's ambient sound, a door somewhere below her that opened and didn't close, a shift in the air pressure that was subtle enough that she registered it more as a physical sensation than a sound. She was at the corridor junction when it happened, talking to Torres about the door's sensor display, and she stopped mid-sentence. Torres looked at her. "What?" "Something opened on the floor below." He was on his radio before she finished the sentence. "The second floor. The medical records annex, which was unstaffed after 5 p.m., which connected to the internal stairwell that bypassed the main elevator bank. 3 of them, it turned out. Later, when the full picture came together, she would learn that there had been a 4-person team, 1 in a maintenance vehicle outside as extraction and communication, 3 inside moving through the utility tunnels in coveralls that matched the hospital's contracted service company well enough to pass a casual glance. They were carrying equipment in a service cart. Nobody who'd passed them in the lower corridors had looked twice. What happened next was not a movie firefight. It was shorter and uglier and significantly more confusing than movies suggested. Nathan's team hit the stairwell from 2 directions. Torres from the 3rd floor landing, Bryce from the 2nd, with one of the federal agents covering the corridor junction on the main floor. The 3 men in maintenance coveralls came up the stairwell and ran into Bryce first, and the engagement in the stairwell lasted approximately 40 seconds. And was mostly the sound of impact and shouted commands that Rachel heard through the fire door as a muffled percussive sequence that her nervous system cataloged and processed without her permission. She was in room 318. She was between Veras and the door, not performing, not striking a posture. She was there because the geometry of the room put the door between the window and the bed, and if anyone came through it who wasn't her team, they were going to have to go through her to get to him. And that was a calculation she'd made in the time it took her to cross the room after the first sound from the stairwell. Veras watched her take the position. "You got training for this situation?" he said. His voice was level. He was monitoring his own breathing. She could see it, the deliberate, regulated quality of a man managing his respiratory rate exactly the way she'd told him to. "Some," she said. "More than some," he said. She didn't answer. 40 seconds. Then 60. Then Nathan's voice in the corridor. "Hayes, clear." She didn't move immediately. She made him wait 3 more seconds, listening to the building, reading the silence for anything that felt wrong. Then she crossed to the door and opened it. The corridor was a mess. One of the maintenance carts overturned. A supply cart knocked sideways. 2 of the 3 infiltrators on the ground with their hands being secured and one sitting against the wall with a split lip and the specific expression of a man reconsidering all of his decisions. Torres had a cut across his forearm, bleeding but not serious. Bryce looked entirely unmarked, which Rachel had come to understand was just how Bryce presented regardless of circumstances. Nathan was at the corridor junction with Agent Carver, who had come up from wherever she'd been and was already on the phone with someone in a conversation that had the particular clipped, efficient quality of field reporting to a higher authority. Rachel scanned the corridor. She counted. She looked at the faces of the men on the ground. There were 4 in the team, she said to Nathan. He looked at her sharply. 3 came through the stairwell. Where's the 4th? Nathan was on his radio in 2 seconds. The building-wide check took 90 seconds to come back, and in those 90 seconds, Rachel stood very still in the corridor and thought about the layout of the floor and the most likely position, not breach, but support. And when the radio came back with all clear from positions that she knew did not include the covered parking bridge, she was already moving. The bridge, she said over her shoulder, already at the fire door. Someone check the bridge access. Bryce went past her at a speed that suggested he'd arrived at the same conclusion half a second earlier. The covered pedestrian bridge connected to a corridor on the east wing 3rd floor through a door that was normally locked by keycard. The lock had been bypassed, not broken, bypassed, which meant a cloned credential or an inside key, and the 4th operator was on the far end of the bridge with a directional communications device and a go bag. Running what Rachel had already understood was the operations communications node. He'd been relaying the team's position to somewhere external, which meant the abort decision and the extraction logistics were being managed from outside the building. Bryce handled the bridge. Rachel didn't see exactly how, because she was back in the corridor with her hands on Torres's arm, assessing the cut. Lateral to the radius, clean, not deep enough to have hit the vein, bleeding more impressively than it was dangerous, which was the kind of wound that looked like a crisis and wasn't. She applied direct pressure with the supplies she pulled from the overturned cart, used the tourniquet protocol to slow the bleed without compressing the nerve, and told Torres to hold the pressure while she retrieved proper materials from the supply closet 6 feet away. "You're fine," she said. "I know I'm fine," Torres said, with the dignity of a man determined not to be treated as a patient. "Good. Keep holding that." She returned with gauze and tape. She dressed the wound with the speed of someone for whom wound care under pressure was not a skill she'd acquired in a classroom, and Torres watched her hands work with an expression that shifted during those 90 seconds, from professional tolerance to something more complicated. "How long did you serve?" he asked. Rachel tore the tape with her teeth. "Hold still." He held still. By 8 p.m., the floor had been swept 3 times. The 4 infiltrators were in federal custody, the comms operator from the bridge added to the 3 from the stairwell. Agent Carver was coordinating with a field office that Rachel gathered was not the Philadelphia office that had been mentioned earlier, but something with different initials and a different chain of command. The corridor had been cleaned, the overturned cart set up right, and the hospital's administrative security team had been carefully sidelined by a process that Carver managed with the diplomatic efficiency of someone who had done this particular sideline maneuver before. Drummond appeared on the floor at 8:30, escorted by an aide, and stood at the corridor junction with the expression of a man who had been running an institution for 11 years and was now discovering that institutions had ceilings he hadn't known were there. He saw Rachel. He opened his mouth. "Not now, Harlan," Nathan said, without looking up from his phone. Drummond closed his mouth. He looked at Rachel for another moment, something moving across his face that wasn't quite an apology, but was in the neighborhood of one, and then he retreated to the elevator. Rachel watched him go. She thought about the suspension email. She thought about the 7:14 a.m. timestamp in Sloan's 1:08 a.m. complaint and the legal aid clinic in Scranton she'd left a message with that morning, which now felt like it had happened in a previous geological era. She went back into room 318. Varys was sitting up. His color was better than it had been at any point in the last 24 hours, which was partly the improved positioning and partly, she suspected, the adrenaline of the last 40 minutes having done something counterintuitively stabilizing for a man whose body was calibrated for high-stress situations. His respiratory rate was 19. She checked it without being asked. "Good," she said. "I heard everything," he said. "Sound carries through that door." "I know. The acoustic insulation on these rooms is about 30 years past replacement." "The bridge," he said. "You figured that out before your team did." Rachel pulled the chair to the bedside. She sat down. She was tired. Not the dramatic tiredness of someone who had been through something extraordinary, but the quiet, bone-level tiredness of someone who had been managing multiple simultaneous problems for 20 hours and had not eaten properly in the same period. "Building knowledge," she said. "Rachel." He used her first name, which he hadn't done before, and something in the way he said it was different from how anyone else had said it in that hospital in 4 months. Not like furniture, not like a problem, not like a subordinate, like a person. Who are you? The room was quiet. Outside, she could hear Carver on the phone, Nathan's low voice in conversation with Bryce, the normal hospital sounds of a floor returning to its usual frequency. She thought about what to say. She had been thinking about what to say in response to that question for 6 years. She had answered it with paperwork, with resume language, with the careful architecture of a new identity that fit her well enough that most days she forgot she was wearing it. But Damon Verez was looking at her with the eyes of a person who had been in enough places to recognize the specific shape of someone who had been there too. And the cover story felt, in this particular room, like the loneliest possible answer. I was a combat medic, she said. Classified support attachment to Special Operations Task Forces. 2 tours in conditions I can't specify under assignments that don't appear in my official service record. She looked at her hands. I left 6 years ago. Why? She was quiet for a moment. We lost people, she said, in a situation that could have gone differently, that should have gone differently. She looked up. I made calls that day that I believed were right and that I would make again, and 6 people still didn't come home. After that, I needed to be somewhere I could put my hands on a person and have it be enough. He held her gaze. Is it enough? She thought about that honestly. About 4 months of night shifts and Donna's exhausted professionalism, and the teenager with the window glass hand, and the 40-year-old with the dislocated shoulder, and the construction worker with the pneumothorax, and the specific silence that had told her Damon Verez wasn't breathing in Bay 7. Most nights, she said. Yeah. He nodded slowly, the nod of a person who understood what most nights cost. Nathan appeared in the doorway. He looked at Rachel with an expression she hadn't seen from him before. Something more measured than the operational urgency of the last several hours. Something that suggested a conversation she wasn't going to like. I need a minute, he said. Rachel stood. Verez reached out and put a hand briefly on her forearm. Not grabbing, not pressuring, just a momentary contact that communicated something she didn't have language for but understood. She followed Nathan into the corridor. He walked her to the window alcove at the end of the hall, away from Torres and the federal agents, where the light from the parking structure came through the glass in oblique yellow rectangles. Carver's team has been pulling records, he said. They flagged your service jacket. She said nothing. Not the cover file. The actual one. His voice was careful, not accusatory, something more like the tone of a man delivering information to someone who deserves to receive it properly. Clearance level and compartmentalization kept it sealed, but the federal investigation running parallel to Verez's situation operates under a different authorization tier. They have access to records your nursing credentialing committee never knew existed. Rachel looked at the parking structure lights. Okay, she said. They know who you were, Rachel, what you did, the task force you were attached to, and the classification of those operations. He paused. They also know about the incident 6 years ago, the one you referenced. The oblique yellow light sat on the floor between them. And, she said, and the official record of that incident is not what you were told it was. Nathan kept his voice level. The after-action report you received was redacted. What you saw was a partial summary, edited to support a narrative that protected institutional decisions made above your pay grade. The calls you made that day. He stopped. Carver wants to show you the full report. Tonight. Rachel stood very still. 6 years. 6 years of carrying the specific weight of believing that she had been part of something that went wrong, that the dead were partly the consequence of her decisions, that the right response to that was to become someone quieter, smaller, more careful. A community clinic in Vermont, a night shift in Pennsylvania, the minimum viable footprint of a person trying to cause as little damage as possible. How much of it was redacted, she said. Enough, Nathan said, that you might have made a different decision about leaving. She looked at him. His face, in the parking structure light, was steady and tired and honest in a way that she had learned to distinguish over the years from the faces of people who were managing her. She opened her mouth to respond, and then every light in the corridor went out. Not a flicker, not the gradual failure of a power issue working through the system. All of them, simultaneously, in the specific absolute way that meant the primary circuit to this floor had been cut. Emergency lighting kicked in 3 seconds later, Red-tinged, low-lumen, enough to see shapes and movement but not faces. From somewhere below them she heard an alarm. Not a fire alarm, the hospital's security lockdown alarm, which she had heard tested twice during her months at Garfield Voss, and which had a very specific two-tone pattern that the testing announcement had told her meant perimeter breach, exterior doors. Nathan had his radio up before the alarm's second cycle. The response that came back was 3 words: East entrance, multiple. Rachel was already moving back toward room 318 before he finished processing it, because the east entrance was the entrance nearest the parking structure, and the parking structure was where the covered bridge connected, and the covered bridge was where they had caught one man, which meant that if there were multiple people at the east entrance now, the communications node they'd disabled had been a relay, not the source, and whatever signal it had been sending before Bryce took it down had been received and answered. The 4th operator hadn't been running extraction. He'd been calling in reinforcements. She pushed through room 318's door. The emergency lighting cast Vera's in red shadow, and he was already sitting up, already reading her face, already assessing. "How many?" he said. "Unknown." She went to the window. The parking structure's external lights were still on. The power cut was selective, this floor only, which meant it was precise, which meant whoever had done it knew the building's electrical layout at the circuit breaker level. "Nathan." He was in the doorway. "They know this floor's layout," she said. "Someone gave them the schematics." She thought fast, the way she had once thought fast as a professional habit, and had spent 6 years trying to slow down. "The service elevator, does it have independent emergency power?" Nathan relayed the question. The answer came back. "Yes, yes," he said. "If we can get Varys to the basement level, there's a tunnel access to the annex building. Separate structure, different power grid, its own emergency protocol." She looked at Nathan. "It's 30 meters of tunnel, and he's not going to love the exertion, but it's the only route that doesn't go through a corridor with a compromised power grid and an unknown number of hostiles who have already demonstrated they know exactly where he is." Nathan looked at Varys. Varys was already pushing the sheet back. "Don't run," Rachel said to him, her voice carrying the specific flat authority of someone who had decided this was not a suggestion. "You walk. You keep your breathing rate under control. If you feel your chest tighten, you tell me immediately." "Copy," he said. She looked at Nathan. "Get Bryce to the service elevator," she said. "Torres on the stairwell door, and somebody needs to tell Carver what's happening because she's going to need to have assets at the annex building exit in the next 6 minutes." Nathan was already on the radio. Rachel pulled Varys's IV line. A clean disconnect. She'd checked the port earlier and knew it was a simple saline line with no active infusion, the kind of line that existed as a precaution and not a treatment need, and removing it took 4 seconds and a piece of gauze from her jacket pocket that she'd been carrying since she dressed Torres's arm. Old habits. Varys stood. He was 6'2" and built for work, and he was running on approximately 60% of normal respiratory capacity and 0 pain management, and he stood without flinching and looked at Rachel Hayes with an expression that she recognized as the particular respect of one professional for another. She handed him a folded blanket from the bedside chair as a makeshift pressure layer for his lower left abdomen. Not medically elegant, but it would remind him physically to moderate his movement and keep the area protected from impact. "This is going to be undignified," she told him. "Good thing I don't care about dignity," he said. They moved into the corridor. The emergency lighting painted everything in flat red. At the far end of the hall, she could hear voices. Not shouting, which was somehow worse, the controlled coordination of a team that had done this before and was not improvising. Bryce was at the service elevator. Doors open. Waiting. Rachel put Varys in front of her and kept her hand at his left shoulder blade, not guiding him, just present, monitoring his movement quality, the way his breath changed when he moved, the subtle signs that would tell her before he knew himself that he was in trouble. They reached the elevator. She turned to look back down the corridor. The door at the far end, the main corridor entry, opened. In the red emergency light, she saw a figure in maintenance coveralls, and then a second one behind it, and she had approximately 2.5 seconds to assess the situation before the elevator doors closed. In those 2.5 seconds, she saw the maintenance cart they were pushing, and she recognized what was on it. Not tools, not weapons in the conventional sense. a portable device with a very specific form factor that she had seen twice in her previous life, in contexts that she had classified under the category of things she did not think about on purpose. Her hand shot out and grabbed Nathan's sleeve before the doors closed. "Nathan." Her voice was absolutely level. "That cart." He looked. She watched his face change. "That's not a breach team," she said. "They're not here to take him." The elevator doors closed on Nathan's face, which had gone the specific gray of a man recalculating everything. The elevator began to descend. "What is it?" Varys said beside her. His breathing was elevated but controlled. His color was managing. Rachel looked at the floor indicator above the door. "Basement. 15 seconds. "They're here to make sure," she said, "that there's no one left in that room to testify." The elevator hit the basement level with a mechanical thud that was slightly harder than it should have been. The kind of imprecision that happened when emergency power rerouted to non-essential systems and everything ran at 80% of its design tolerance. Rachel had Varys moving before the doors finished opening. The basement of Garfield Voss was a different world from the clinical floors above. Exposed pipe runs, concrete block walls painted industrial gray sometime in the previous century. The smell of boiler exhaust and the particular damp that came from a building built partly below the water table. The tunnel access she'd described to Nathan was 40 meters east through the mechanical room and past the central sterilization unit that ran 24 hours and produced a constant low-frequency hum that she could feel in her back teeth. Bryce went first. Rachel stayed at Varys's left shoulder. His breathing rate was 21. She monitored it without looking directly at him, tracking the sound and rhythm the way she tracked a monitor readout. Peripheral, continuous, processed as data rather than observed as event. "Carver's people are supposed to be at the annex exit," Bryce said, without turning around. "They need to know about the device on that cart," Rachel said. "Nathan saw it. He'll relay. But if he's managing the third floor right now..." "He'll relay," Bryce said. Flat, certain. The conviction of someone who had worked with Nathan Cole long enough to have evidence for it. Rachel accepted that and kept moving. The mechanical room was loud. The boilers occupied most of the south wall and radiated heat that was almost physical in its pressure, and the central sterilization unit along the east wall cycled with a rhythmic hydraulic exhale that measured time in 4-second intervals. The tunnel entrance was a reinforced door with a push bar, the kind installed in the 1990s as part of a fire egress upgrade that nobody had updated since, and Bryce hit it at speed and held it open. 30 meters of tunnel. Concrete floor, pipe ceiling, a string of yellow work lights on a circuit that operated independently from the main building. They were on, which meant whoever had cut the third floor power hadn't reached this deep into the system yet, or hadn't known about it. Varys moved through the tunnel without speaking, his breathing rate climbing to 22 on the exertion and then holding there, which was the ceiling she'd given him, and the fact that he was holding it precisely told her that he was managing himself with the deliberate attention of someone who had taken her instructions as operational parameters rather than medical suggestions. 20 meters. 15. From somewhere above and behind them, through the concrete, she felt rather than heard a low concussive pressure. Not an explosion, nothing structural, but the specific pressure signature of a device discharging in an enclosed space on the floor above. And she knew without being able to see it that room 318 no longer looked the way it had when they'd left it. She kept walking. 10 meters, 5. The annex exit door, a twin of the one they'd entered, with the push bar and the institutional paint and a small square window at eye level through which she could see a dimly lit utility corridor, and beyond it, 2 figures in dark clothing who were not in maintenance coveralls and were oriented toward the door in a way that meant they were expecting it to open. Carver's people. Bryce identified them through the window and hit the push bar, and they came through into the annex building and the door swung shut behind them, and the tunnel sealed off behind them with the finality of a chapter ending. One of Carver's agents, a woman named Delray, late 30s, with the particular organized energy of someone running on professional adrenaline, took stock of the 3 of them in 2 seconds. "Varys," she said. Confirmation, not question. "Yes," Rachel said. "He needs to sit down in the next 4 minutes. His respiratory compensation is holding, but we've pushed it." Delray was already moving them down the utility corridor toward what turned out to be a loading bay that had been staged. A vehicle, a portable medical kit, 2 additional personnel. Someone had planned the annex exit as a contingency, which meant Carver or Nathan had anticipated this possibility before the third-floor power went out, which meant Rachel was not the only person in this operation who had been thinking 2 steps ahead. She got Veres seated on a crate that was roughly the right height, checked his airway manually, counted his respiratory rate, 20, dropping back toward 19, which was acceptable, and opened the portable medical kit to find it stocked with field-grade supplies that were considerably better than what she'd been improvising with all evening. "Nice kit," she said. "We travel prepared," Delray said. Rachel worked without further comment, reassessing the internal injury positioning, checking his pulse pressure, making sure the field dressing on his lower left abdomen hadn't shifted during the tunnel transit. It hadn't. He'd kept the blanket pressure layer in place through 40 meters of tunnel walking and hadn't mentioned it once, which was either discipline or stubbornness, and at this point she'd stopped distinguishing between the two. Her phone buzzed. "Nathan. 3rd floor contained. Device secured before discharge. 2 additional subjects in custody. Are you clear?" She typed back, "Clear. Annex loading bay. Veres stable." The response came in 4 seconds. "Stay put. Carver needs a full debrief." This got complicated. She looked at that last sentence for a moment. This got complicated was the kind of message you sent when the situation had revealed a layer that changed the shape of everything above it. She put the phone in her pocket and finished the reassessment and sat back on her heels and looked at Damon Veres, who was looking at the loading bay ceiling with the expression of a man processing something that wasn't physical. "Device on the cart," he said. "You recognized it?" "Yes." "Where from?" She met his eyes. "A situation I was part of 6 years ago. Different context, same technical signature." She paused. "The people who came for you tonight weren't improvising. That device requires technical preparation time and access to components that aren't commercially available. Someone built it for this specific operation, which means this wasn't a reactive decision. They planned for the possibility that a direct extraction team would fail and they'd need a secondary solution." "Burn the room," he said quietly. "Burn the room," she confirmed. He was quiet for a moment. Then, "You said 6 years ago. Different context." "Yes. The incident you told me about. The one where you lost people." Rachel sat still. "The device you recognized, was it used in that incident?" She looked at him steadily. "Not the same device. Same design lineage, same technical family." She kept her voice even. "I've been thinking about that since the elevator." Veres straightened slightly, and she saw the calculation running behind his eyes. The kind of rapid information integration that happened when a field operative received a data point that recontextualized a larger picture. "Nathan told you your after-action report was redacted," he said, 15 minutes before the lights went out. "And whatever was redacted from it," he stopped, looked at her. "You think it's connected to tonight?" She didn't answer immediately because she hadn't finished thinking it through, and she was not in the habit of speaking conclusions she hadn't fully examined. But the shape of it was there, the device on the cart, the 6-year-old incident, the redacted report, the international intelligence network that Carver's team was apparently dismantling in real time. And at the center of it, Damon Veres and whatever testimony he was carrying that someone had decided was worth multiple felonies and at least 1 charge of attempted assassination to prevent. "I think," she said carefully, "that I need to see that full report." Carver arrived at the annex loading bay 40 minutes later, and she arrived with Nathan and with a 3rd person Rachel hadn't seen before. A man in his 50s, silver-haired, in civilian clothes that were expensive enough to be noticed and worn carelessly enough to suggest he'd stopped noticing them years ago. He had the bearing of someone who operated several levels above field work and had come down to the field tonight because the situation required a decision that only his level could authorize. He looked at Rachel for a long moment before anyone introduced him. "Ms. Hayes," he said, "I'm Deputy Director Harlan Moss, Office of Special Operations Oversight." He extended a hand. She shook it. His grip was brief and dry and entirely without performance. "We've been looking at your service file for the last 2 hours. Nathan mentioned it." Nathan mentioned part of it. Moss looked at Carver, who produced a tablet and handed it to Rachel without comment. She looked at the screen. The document was headed with a classification level she hadn't seen applied to her own name before, and below it was the after-action report from the incident 6 years ago, not the redacted version she'd received, which had been 11 pages of carefully managed summary, but the full document, 43 pages, with the redacted sections restored in a different font color that made the additions immediately visible. She read it standing up, in a loading bay, with Varys 15 feet behind her, and Nathan, and Moss, and Carver, watching her with the careful stillness of people who understand they are witnessing something that deserves space. It took her 9 minutes. The 6 people who had died that day had not died because of her calls. The official record she'd received had removed 3 critical sections. The communications logs showing that a decision made at the command level, 2 echelons above her, had overridden her field assessment and redirected a support asset that she had specifically requested and been verbally confirmed to receive. The asset had been pulled, the window had closed. The outcome had been determined by that decision, not by hers. She had spent 6 years carrying the weight of deaths she had not caused, because someone above her had managed the paperwork to protect themselves. And the easiest person to leave holding the remainder was the field medic who'd already separated from service and wasn't in a position to fight the record. She lowered the tablet. The loading bay was very quiet. "Who authorized the redaction?" she said. Not a question. The inflection of someone who already knows the answer is available and is establishing that they want it spoken aloud. "A senior operations director named Gareth Wohl," Moss said, "who retired 18 months ago and has been the subject of an ongoing investigation for conduct that includes this incident, 3 others with similar documentation irregularities, and, as of approximately 6 hours ago, based on intelligence Sergeant Varys was carrying when your team brought him in last night. Direct financial ties to the foreign network that staged tonight's operation." Rachel set the tablet down on the crate next to Varys's kit. She stood with her hands at her sides and breathed through something that was not quite rage and not quite grief, but had elements of both. The specific, disorienting pain of a wound you'd thought was healed, revealing that it had never been properly treated, just covered. "He's in custody?" she said. "As of 4 hours ago," Moss said. "The arrest was coordinated with tonight's operation. They moved simultaneously, the field team here and an arrest team at Woolley's residence in Maryland." She nodded once. It was a small, precise nod, the kind that meant received rather than satisfied, because satisfaction was a thing that would take considerably longer to locate than this conversation allowed. "Your record," Moss said, "will be corrected. Formally. With documentation. The redacted sections will be restored, the after-action will be reissued under the corrected authorization, and a formal statement of commendation for your field decisions that day will be added to your permanent file." He paused. "That doesn't fix 6 years." "No," Rachel said. "It doesn't. No." He held her gaze. "I'm sorry for that." She looked at him. She looked at Nathan, who was watching her with the expression of a person who has delivered difficult news and is waiting to see what the recipient does with it. She looked at Varys, who was sitting on his crate with his hands on his knees and his respiratory rate at a manageable 18, and his eyes on her face with the steady, uncomplicated attention of someone who had decided she deserved to be seen clearly. "Okay," she said. "What happens now?" What happened now was 12 hours of controlled, grinding institutional process that bore no resemblance to the sharp kinetic drama of the previous night and was, in its own way, more exhausting. Federal investigators came and went from the annex building in shifts. Varys was transported to an actual secure medical facility, a military hospital 40 minutes outside Dunmore, where a surgical team evaluated his internal injury and determined it had stabilized sufficiently to manage without intervention, which was good news delivered with the flat effect of military medicine, which Rachel found more reassuring than any amount of bedside warmth. She was present for the evaluation, and the evaluating surgeon, a colonel named Dr. Patricia Fenn, looked at Rachel's documentation of Varys's airway management and positional protocol with the expression of someone reviewing competent fieldwork. "You maintained this protocol through an active security incident?" Fenn said. "Yes." "Without interruption to the therapeutic positioning?" "One interruption, 40 meters of tunnel. I monitored his rate through the transit." Fenn made a note. She didn't say anything else about it, but she made the note, and in Rachel's experience, the note was the thing that mattered. Rachel gave her debrief to Carver in a conference room at the military facility, a 90-minute session that covered everything from the initial airway assessment in Bay 7 to the device identification in the elevator. and Carver took notes in the same deliberate underlining style that Rachel had observed the day before, which she'd come to understand was not a quirk, but a signal. Carver underlined the things she intended to act on. She underlined a lot. At 11 a.m., Nathan found Rachel in a corridor outside the conference room, sitting on a bench with a cup of coffee that was considerably better than Millie's Diners, eating a packet of crackers from a vending machine with the focused, joyless efficiency of someone fueling a vehicle. He sat down next to her. "Wola talked," he said, "through the night. His attorneys tried to slow it down, but the evidence volume is substantial enough that they apparently advised cooperation." He paused. "The foreign network Veres was carrying intelligence on. It's larger than our initial assessment. 17 confirmed assets across 4 domestic cities, including 2 placed inside federal agencies at low to mid levels. The device on that cart last night traces to a technical specialist connected to the network who's been operating domestically for 3 years." Rachel ate a cracker. "And the hospital?" "Garfield Voss is being examined for the internal source who provided the schematics and the key access." He looked at her. "We have a working theory." She waited. "The maintenance access keys that the first team used came from a set that was copied from originals held in the hospital's facilities management office," Nathan said. "The facilities manager on shift last night signed out a set at 4 p.m. for a reported maintenance inspection. Those keys were not returned at end of shift. The facilities manager is a man named Dale Pruitt, 41, no notable history, except that he took a significant personal loan 18 months ago from a financial entity that our analysts flagged this morning as a front connected to the same network." "He didn't know what he was part of," Rachel said. "It wasn't a defense, more an assessment." "Probably not. Probably thought he was passing access to someone who wanted to steal medical equipment or pharmaceutical inventory. People don't generally know when they've been recruited into an espionage operation. They think they know a guy who pays well for small favors." He paused. "He's being interviewed now." Rachel looked at her coffee cup. She thought about Dale Pruitt, 41, who had taken a loan from the wrong people and passed a set of keys without understanding what they were for, and who was now sitting in a room answering questions that would define the next decade of his life. She thought about how operational networks worked, the layers of distance, the transactional insulation, the way the people at the outer edges never saw the shape of the thing they were part of. "Sloan," she said. Nathan was quiet for a moment. "Sloan is not part of the network," he said. "We looked. He's exactly what he appears to be. A self-important physician who filed a vindictive complaint because a nurse embarrassed him." He said it without editorializing, which somehow made it worse. He did make a call, though, at 2:17 a.m. after he filed the complaint, to a former colleague at another hospital who he's apparently close to. He mentioned the patient in Bay 7, the federal presence, and your involvement. "And this colleague has no connection to the network." Sloan was just venting. Nathan looked at her. "He didn't know what he was doing. He's not a villain. He's just careless," Rachel said. "Careless," he agreed. She finished the crackers. She thought about this difference between people who chose to cause harm and people who caused harm because they couldn't be bothered to think far enough ahead, and she thought about which of those categories was ultimately easier to deal with and decided it was neither. They were just different species of problem requiring different responses. "Drummond called the annex facility this morning," Nathan said. "He spoke to Moss. He's been briefed, selectively, the parts that bear on the hospital's situation, and he's asked to meet with you." "When?" "Whenever you're ready. There's no pressure." She looked at the corridor wall. Standard military facility construction, drywall, institutional paint, a fire extinguisher in a red cabinet every 30 feet. "And Sloan?" she said. "Also Drummond's problem," Nathan said. "Though Moss's office is sending a formal communication to the hospital's board regarding the conduct complaint and its circumstances, they won't be telling Drummond what to do, but they'll be telling him what the record shows." Rachel thought about the 1:08 a.m. complaint, the 7:14 a.m. suspension notice, the specific architecture of a retaliation conducted through institutional channels by a man who had the authority to make it stick, and had exercised that authority within 90 minutes of being shown that he'd missed something a nurse on his floor had caught. She thought about what she'd said to Veres in the room when she'd told him she'd needed to be somewhere she could put her hands on a person and have it be enough. She thought about whether that was still the right answer, or whether it had been the answer for 6 years ago, and had simply never been updated because updating it required looking at it directly. "I want to go back to the hospital," she said. Nathan looked at her, not surprised. "There's unfinished business," she said. "What?" She drove herself back to Garfield Voss at 2 p.m. in her 12-year-old Honda, in the same clothes she'd been wearing for 31 hours, with a borrowed jacket from the military facility that was 2 sizes too large and smelled like institutional laundry detergent. She had not slept. She was operating on 3 cups of coffee and a packet of crackers, and the particular wired clarity of someone whose nervous system had been running at elevated capacity for long enough that it had found a sustainable frequency and decided to stay there. Donna met her at the main entrance, which meant someone had told Donna she was coming, and Donna had decided that meeting her at the entrance was important enough to leave the floor for. She looked at Rachel the way people look at someone when they've spent the night imagining scenarios that turned out to be worse than the ones they'd allowed themselves to consider. "You're okay?" Donna said. Not quite a question. "I'm okay." Rachel paused. "How's the floor?" "Third floor is sealed off. There are federal people everywhere. The staff is scared and confused, and Drummond's been on the PA 3 times reminding everyone about patient privacy protocols as if that's the issue." Donna's jaw set. "And Victor's been in his office since 7 this morning not seeing patients. You know I'm back?" "He will in about 4 minutes." Rachel nodded. "I need to see Drummond first." Drummond's office was on the administrative floor, second building, accessed through a connector corridor that Rachel had used twice in 4 months for credentialing paperwork. It had a view of the parking structure and a wall of framed certificates that were arranged with the slightly too deliberate precision of a man who thought about the impression they made. Drummond stood when she came in. He looked like someone who had aged measurably since the previous morning. Not dramatically, but in the small accumulated ways of a person who had spent 24 hours discovering that the ground they'd been standing on had different properties than they'd assumed. "Ms. Hayes," he said, "please sit." She sat. He sat. He had a file folder in front of him that he touched without opening, the physical tick of someone using an object as a focusing point. "I owe you an apology," he said, "for the suspension notice, for the speed with which it was issued and the process by which it was—" "Drummond," she said, not unkindly. "I know what happened. Let's not perform the apology. Tell me what you're going to do." He blinked. Then, with the relieved expression of a man given permission to skip a painful formality, "The suspension is rescinded, effective immediately, with full back pay for the period covered. Your access credentials will be reactivated by end of day." He paused. "The conduct complaint, Dr. Sloan's complaint, will be formally withdrawn from your personnel file and a corrective notation added to explain its circumstances." "And Sloan?" Drummond's hands moved on the file folder. "Dr. Sloan is being placed on administrative leave pending a formal review of his conduct toward nursing staff. Not only regarding your incident, the federal communication that arrived this morning prompted our HR department to pull his file comprehensively, and there are documented patterns involving multiple nurses over a period of approximately 3 years that should have been escalated previously and were not." Rachel held his gaze. "Were not, or were filed and not acted on?" He didn't look away. "Both," he said, "depending on the instance." That was more honest than she'd expected, and she gave him credit for it. "I'll be back on shift tonight," she said, standing. "Night shift, as scheduled." He stood as well. "Of course. And Ms. Hayes—" He stopped. She looked at him. "What you did for that patient," he said, "in Bay 7, without authorization, against protocol, in circumstances that were considerably more complex than anyone in this institution understood at the time." He held her gaze. "I've been in hospital administration for 22 years. I know the difference between a nurse who breaks protocol out of ego and one who breaks it because the protocol has failed the patient. I should have looked at what happened more carefully before I let that complaint proceed." She stood in the doorway. "Yes," she said. "You should have." She left him with that because it was accurate and because anything softer would have been untrue, and she had spent enough of the last 6 years softening true things to make them more comfortable for people who should have been uncomfortable. The corridor outside Drummond's office connected back to the main building via the second-floor walkway, and she was halfway across it when she saw Sloan. He was coming from the other direction, which meant he'd been in the administrative wing, which meant he'd probably just come from a conversation with HR or legal that had gone in a direction he hadn't anticipated. He was carrying his coat over one arm and he was looking at the floor, and he didn't see her until they were 10 feet apart. He stopped. She stopped. The walkway was wide enough for two people to pass without speaking if they chose to. He could have chosen to. She could see him considering it, the calculation running across his face with the transparency of a man whose composure was under strain. He didn't move. "Hayes," he said. The half-second wait was gone. It was just her name. She waited. He stopped. His jaw worked. She watched the progression of a man trying to locate an adequate version of himself and having difficulty with the search. "I didn't know," he said. "Any of it. What was happening with that patient? What?" He made a gesture that encompassed the previous 24 hours imprecisely. "I didn't know." "I know you didn't," she said. He looked at her with the expression of a man who'd been prepared for anger and had received something more difficult. "The complaint," he said. "You filed it because I went into a bay you hadn't authorized, and I was right about what I found there and you weren't, and that was something your ego couldn't absorb at 1 a.m. She kept her voice completely level. "I understand why you did it. Understanding it doesn't make it acceptable." He said nothing. "The patients on your service," she said. "The junior nurses on your floor, the residents who work under your supervision, the way you talk to them, the way you position your authority against their judgment. That's been documented, Sloan, and it's been documented for 3 years. And people have been quietly absorbing it because you're the attending, and they need the shift and the reference and the peace of continuing to work." She looked at him steadily. "You're a good surgeon. You could be a good physician. Those are different things, and you've never had to figure out why." He held her gaze. His face was doing something complicated and not entirely comfortable to watch. The internal reorganization of a person who has received accurate information about himself and hasn't yet decided what to do with it. She walked past him. At the far end of the walkway, she stopped and turned back. He was still standing there, coat over his arm, watching her. "Respect shouldn't depend on someone's past," she said. "It should depend on how you treat people today." She left him on the walkway and went back to the floor. At 4:30 p.m., Moss's office sent a communication to Garfield Voss's board. Not the selective briefing Drummond had received, but a formal document that covered the federal investigation, the security incident, the role played by nursing staff in protecting a federal witness, and a specific commendation for Rachel Hayes by name that recommended the board review its personnel decisions from the previous 24 hours with appropriate urgency. The board's response arrived in Drummond's inbox at 5:15. At 5:47, Pete Grabowski found Rachel at the nurses' station restocking supply carts, because the supply carts always needed restocking and somebody had to do it, and she'd been doing it for 4 months and she wasn't going to stop now, and handed her a printout with an expression she couldn't immediately categorize. She read it. It was a formal board resolution, drafted with the speed of an institution that had decided collectively to get ahead of a situation, restoring her position, expunging the conduct complaint, and this was the part she read twice, authorizing the creation of a new role, Director of Emergency Trauma Protocol Review, reporting directly to the Chief of Medical Staff, with a mandate to audit and revise the department's emergency response procedures. She set the printout on the supply cart. Pete was watching her. "You're going to say yes," he said. It wasn't quite a question. Rachel looked at the supply cart. She looked at the nurses' station, where Donna was charting with the focused efficiency of a woman who had been holding the floor together through 24 hours of institutional upheaval and was going to keep holding it regardless of what the board decided. She looked at the corridor of Bay 7, where the curtain was open and the bay was empty, and the monitors were dark and clean. Her phone buzzed. "Nathan. Varys is stable. Fenn cleared him for the secure facility transfer tomorrow. He wanted me to tell you, whatever you decide about the offer, he'll speak to it." She looked at that for a moment. "What offer?" she typed back. His response was immediate. "The one Moss is about to make. Check your email." She opened her email. The message was from Deputy Director Moss's office, sent 11 minutes ago, and it was not long, 2 paragraphs, direct, no bureaucratic cushioning. A formal request for Rachel Hayes to consider a consulting role with the Office of Special Operations Oversight, advising on medical protocol for field operations, and specifically, assisting with the investigation into Gareth Wool's documentation irregularities and their impact on personnel whose service records had been affected. The second paragraph contained a sentence she read 3 times. Your file has been reviewed by this office and by the relevant operational commanders. The after-action record for the incident of 6 years ago has been formally corrected. Your decisions that day are now reflected accurately in the permanent record, and this office wishes to state unequivocally that your field judgment was sound, your recommendations were correct, and the outcome was the result of command decisions made above your level, not of any failure on your part. Rachel stood at the nurse's station with her phone in her hand and the supply cart half restocked beside her, and she stood there for long enough that Donna came over and touched her arm. You okay? Rachel looked up. She looked at Donna's face, exhausted, professional, genuinely asking. Getting there, she said. She slid the phone into her pocket. She picked up the supply cart handle. And then Donna said quietly, the board resolution, the new role. I know. Are you? I'm thinking about it, Rachel said. She pushed the cart forward. Right now, though, these shelves aren't going to stock themselves. She moved down the corridor with the cart, the same corridor she'd walked 100 times in 4 months, and stopped at Bay 4's supply cabinet and opened it and began putting things in order with her hands, which were steady, as they always were. Her phone buzzed again. Not Nathan this time. Blocked number. She stared at it. Then she answered. Ms. Hayes. A voice she didn't recognize. Older, male, the particular smoothness of someone accustomed to conducting important conversations on unsecured lines and confident in their ability to manage the risk. I think we have something to discuss. Something that wasn't in the report Deputy Director Moss's office sent you. Rachel set down the supplies she was holding. My name is Wola, the voice said. Her hand tightened on the phone. Gareth Wohl, the voice continued, with the unhurried patience of a man who was supposed to be in federal custody in Maryland and was very clearly not. And I need you to understand something before you make any decisions about Deputy Director Moss's offer. A pause, precise and deliberate. I need you to understand what those 6 people you lost 6 years ago actually knew, and why the decision to pull that asset was made by someone you haven't been told about yet. Rachel did not move. She stood at Bay 4's supply cabinet with her hand on the phone and the supply cart beside her and the corridor running quiet in both directions. And she let Gareth Wohl's voice sit in the air of that empty bay for 3 full seconds before she responded. You're supposed to be in custody, she said. Supposed to be is doing a lot of work in that sentence. His voice was measured, the cadence of someone who had rehearsed this conversation or something close to it. The arrest in Maryland was real. My attorneys secured a temporary release on a procedural challenge 2 hours ago. I have perhaps a short window before that's corrected. A pause. Which is why I'm calling you instead of anyone else. Why me? Because you're the one person in this situation who has a genuine reason to want the complete truth rather than the version that makes the institutional actors look clean. His voice shifted. Not warmer, but more direct. The drop of performance that happens when someone decides a tactic isn't working and tries the adjacent one. Moss's office is giving you a corrected record. They're telling you the asset pull was a command-level decision above your grade. That's true. What they are not telling you is whose command, because that person is currently a serving official at a level that Moss's investigation has been carefully structured to not reach. Rachel looked at the corridor, empty. Donna at the far station back-turned charting. She made a decision. I'm going to put you on hold, she said, for 30 seconds. She lowered the phone and walked fast to the nurse's station, kept her voice low and flat. Donna, I need you to call Nathan Cole's number. It's in my recent calls, the contact labeled NC, and tell him I have Wole on a blocked line right now. Tell him to trace it. Donna looked at her for 1 second with an expression that asked 0 questions. Go, Rachel said. She walked back to Bay 4, picked up the phone. I'm here, she said. That was more than 30 seconds, Wall said. I was getting a glass of water, she said. Keep talking. He kept talking. What he said over the next 6 minutes was, in structure, the thing that people with information and diminishing leverage always said. A combination of genuine disclosure and strategic omission, the truth deployed as currency rather than offered as confession. He was buying something with it. She understood that. She listened anyway because whatever he was buying with it, the information itself was either real or it wasn't, and she had enough context now to evaluate it. The name he gave her was real. She knew it. Not personally, but professionally, in the way you know the names of people who exist 2 levels above the decisions that affect you. A deputy undersecretary in a defense oversight role, appointed 4 years before the incident 6 years ago and still serving. A person whose position made them architecturally invisible to the kind of investigation Moss was running, because the investigation's jurisdictional boundaries had been drawn with a specificity that, Vola was arguing, was not accidental. Vola, she said, when he'd finished the relevant section. Why does this help you? Because if that name is in the public record before my trial, the prosecutorial calculus changes significantly, he said. They've built their case on me as the apex of this network. If there's a documented superior, you want me to go public with it. I want you to tell Moss you heard it, he said, directly, tonight, before the procedural window closes and I'm back in a room where my communications are managed. Rachel stood at the supply cabinet with the phone against her ear and thought about Gareth Wohl, a man who had redacted her after-action report to protect himself, who had let 6 people's deaths be attributed to decisions they hadn't made, who had spent years as a functional component of a foreign intelligence network and was now using the people he'd damaged as the last instrument available to him. She thought about whether the name he'd given her was worth anything. She thought about the 6 people who hadn't come home. I'll tell Moss what you told me, she said. Not as a favor to you, because if it's true, it should be in the record, and the record is what matters, not you, not your trial strategy. A pause. That'll do, he said. Voila. She kept her voice even. Whatever happens with your procedural window and your attorneys, whatever deal you think this buys you, the people on that network who came into this hospital last night are going to be prosecuted for it, and everything that traces back to you is going to be in the evidentiary record regardless of what name you hand over. You understand that? Silence. The record, she said, is going to be complete this time. She hung up. She stood in Bay 4 for a moment, looking at the empty bay, the clean monitor, the folded linens on the unmade bed, the supply cabinet with its organized shelves, the same bay where she'd been monitoring a 40-year-old woman with a dislocated shoulder 2 nights ago, in a different geological era of her life. Her phone rang immediately. Nathan. Tell me you got it, she said. We got it, he said. Cell tower triangulation. He was at a law office in Harrisburg, his attorney's building. We're coordinating with local to pick him up now. A beat. What did he say? She told him. All of it, including the name, which she delivered with the flat precision of someone reading from a clinical note, because that was how she'd filed it in her mind, as data, as a thing that needed to go into the correct place in the correct record. Nathan was quiet for a moment after she finished. How did you know to stall him? He said. I didn't stall him, she said. I listened to him. There's a difference. Another beat. Then, with the particular quality of a person who has been observing someone for 2 days and has arrived at a conclusion. Rachel, go home. Sleep. We have everything we need from you tonight. I have a shift. Your shift starts in 4 hours, he said. Go home for 3 of them. She looked at the supply cart, half stocked, the shelves waiting. The carts need finishing, she said. Pete can finish the carts. She considered that. Fine, she said. And for the second time in 2 days, she put on her jacket and walked toward the exit. Except this time, the corridor she walked through was different. Not in any physical sense. The same fluorescent lights, the same worn linoleum, the same distant rhythm of monitors and rolling equipment, and the low ambient noise of a building that never fully slept. Different in the way that the same room looks different when you've stopped carrying a thing you'd been carrying in it for a long time. She slept for 2 hours and 40 minutes, which was not 3 hours, but was more than she'd managed in the preceding 36. She woke to her alarm and lay in the dark of her apartment for a moment, looking at the ceiling, and did the thing she'd been doing every morning for 6 years. The inventory, the check, the assessment of what the day was going to cost. The inventory was different this morning. Not easier exactly. Not lighter in the way that people describe things when they meant something had been resolved and could be set down. More like accurate. Like a measurement that had been calibrated wrong for years and had finally been corrected, and the new number was not smaller than the old one, just true. She got up. She made coffee. She sat at the kitchen table with the corrected after-action report on her laptop. Moss's office had sent the full document to her email, formally, with a cover letter on official letterhead. And she read it again in the quiet of her apartment at 2 a.m. with her coffee and without the weight of a security incident pressing on every side. She read the sections that had been redacted, the communications logs, her field assessment, time-stamped and specific. The confirmation of the support asset, the subsequent command level cancellation, the timeline that showed exactly what had been available and what had been removed and when. She read her own words from 6 years ago, her voice from a context she'd tried to stop hearing. And they were the words of someone who had known what they were doing and had done it correctly, and had then been handed a version of events that made her responsible for an outcome she had not caused. She closed the laptop. She sat with it. The 6 people were still dead. The corrected record didn't change that, and she didn't spend time pretending it did. What it changed was the specific corrosive weight of having believed, for 6 years, that she had been the variable, that her judgment had been the point of failure. She had built her entire post-military life around the project of becoming someone smaller and more careful, someone whose mistakes couldn't ripple outward into catastrophe. And she had done it on the basis of information that was false. That was the thing she sat with at 2 a.m. at her kitchen table. Not rage, not relief. Something more complicated than both, the particular disorientation of learning that the story you built your life around was built on a chapter that had been written by someone else, in their own interest, at your expense. She drank her coffee. She thought about what she was going to do with the rest of it. Wola was rearrested at 11:47 p.m. the previous night. She learned this from a news alert on her phone, a brief item that named him and cited procedural complications in the handling of his initial custody transfer, which was the institutional language for a federal judge decided the attorney's argument didn't hold. The news item didn't name the deputy undersecretary. That would come later, through a different channel, at a different pace. The grinding institutional pace of a corruption investigation, working its way up a chain whose upper links had spent years making themselves difficult to reach. But it would come. Moss's office had the name now, from Rachel, and from whatever Wola's attorneys had decided to put in writing as part of the custody negotiations, and the investigation's jurisdictional boundary, the one Wola had claimed was not accidental, was being formally challenged by a congressional oversight committee that had been briefed by Carver's team at 6 a.m. that morning. These things move slowly. That was the honest version. They moved slowly, and they were not guaranteed, and the outcomes were not clean, but they moved. Rachel understood the difference now between the things she could put her hands on and fix in 40 seconds and the things that required a longer, duller, less dramatic form of persistence. She had spent 6 years treating the first category as the only one worth staying for. She was revising that assessment. She drove to Garfield Voss at 3:45 a.m., parked in the same spot she always used near the staff entrance, and walked into the building on a reactivated access card that beeped green instead of the denial tone she'd heard 2 mornings ago. Small thing. She noted it anyway. Donna was at the end of her shift, charting the last of the night's patients, and she looked up when Rachel came in with the expression of someone who had been holding a question in reserve. "You okay?" Donna said. "Working on it," Rachel said. Then, because it was accurate and because Donna had earned the more complete answer, better than yesterday, getting clearer. Donna nodded. She understood, in the way of someone who had worked nights in an emergency department for 20 years, that clearer was not the same as fine and was frequently more valuable. "Pete stocked the carts," she said. "Good. 3rd floor reopened at midnight. Federal presence is down to 2 agents for the next 48 hours while they clear the chain of custody on the evidence." Donna paused. "Sloan cleaned out his office yesterday afternoon." Rachel looked up. "He's not fired," Donna said. "Administrative leave pending review, but he cleared his personal items, which, in this hospital, means he knows how the review is going to go." She paused again. "Half the nursing staff came in early this morning, 6 a.m., to tell HR about incidents they'd never reported because they didn't think it would matter." Rachel was quiet for a moment. "It matters now," she said. "Yeah," Donna said. "It does." She closed her chart. She stood, pulling on her coat. She stopped. "The new role, Director of Trauma Protocol Review." "I know. Are you going to take it?" Rachel thought about the 2 offers, Moss's consulting role and the board's new position, and the fact that she'd spent the previous 3 hours sitting at her kitchen table deciding that the answer to both of them was yes, in the specific order that made sense, which was the hospital first and the consulting work as a parallel track, because the hospital was where her hands were, and the consulting work was where the record could be corrected for people like her, who hadn't had the standing or the information to correct it themselves. "Yes," she said. Donna looked at her for a moment with an expression Rachel couldn't entirely classify. Not sentimental. Donna was not a sentimental person, but something in the neighborhood of satisfied. The look of someone whose instinct about a person has been confirmed by evidence. "Good," Donna said. She pulled on her coat. "Don't stock the supply carts tonight. That's not your job anymore." She left. Rachel stood at the nurse's station for a moment, in the quiet of a floor between shifts. That particular window of institutional peace where the night's crises have been managed and the mornings haven't begun yet. And the building breathes at a slower frequency, and you can hear things you can't hear when it's running full. She put on her access badge and went to work. The formal proceeding happened 8 days later. Not a ceremony. Rachel had specifically asked that there be no ceremony, which request had been partially honored in the sense that what happened instead was a meeting in Drummond's conference room at 9 a.m. on a Tuesday that had been described on the calendar invite or as administrative transition briefing and had the quality, when she arrived, of a thing that had been carefully arranged to feel unceremonious while being in fact the opposite. Drummond was there. Carver was there, which Rachel hadn't expected. Moss had sent a representative, not himself, a deputy named Orland, 50s, efficient, who carried a leather portfolio and had the demeanor of someone who delivered formal communications for a living and was good at it. 2 members of the hospital board were present, including the chair, a woman named Dorothea Rice, who ran a cardiology practice in Wilkes Barre, and had the specific focused attention of someone who had read the full briefing document rather than the summary. And Nathan was there. He was at the back of the room, standing rather than seated, and he looked at Rachel when she came in with an expression that was as close to warmth as she had seen on his face, which meant it was restrained and genuine in equal measure. Orland delivered the formal communication from Moss's office, the restoration of Rachel's complete service record, the addition of the commendation, the official statement regarding the 6-year-old incident. He read it in full, which took 11 minutes, and Rachel sat and listened to it read aloud in a conference room in a hospital in northeastern Pennsylvania, and felt something shift in her chest that she would not have described as healing, because that word was too clean for what it actually felt like, which was more like the first honest breath after a long time of breathing badly. Dorothea Rice spoke next, on behalf of the board, in language that was formal and specific, and did not attempt to minimize what had happened in the 48 hours following Rachel's intervention in Bay 7. She outlined the board's decision regarding the new role. She outlined Sloan's administrative status, leave pending review, with a parallel HR process covering the documented conduct history that had been compiled from staff reports. She said, without euphemism, that the review was expected to result in the termination of his attending privileges at Garfield Voss, which she stated as a probability rather than a certainty because the process had not concluded, but the weight of the documented evidence made the conclusion probable. Rachel accepted this without expression. Then Carver spoke briefly, covering the federal investigation status in the terms she was authorized to share. 4 subjects from the hospital incident in custody and awaiting federal charges, the broader network under active investigation across multiple jurisdictions, Wolle's rearrest, and the additional material his attorneys had provided in exchange for prosecutorial consideration. She did not name the deputy undersecretary, but she used language. Additional subjects at senior levels of government are under active investigation. That communicated enough. Then Nathan spoke. He had not prepared remarks. Rachel could tell because he stood at the back of the room and spoke without notes, in the direct, unhurried way of someone who didn't need the script because he was saying a thing he actually meant. "Sergeant First Class Veras asked me to relay something," Nathan said. He wanted to say that in 16 years of operational service, he has worked alongside the best combat medical personnel the military produces. And that what Rachel Hayes did over the course of 48 hours at this hospital, the clinical decisions, the tactical assessment, the decisions made under pressure without authorization or support, was consistent with the highest standard he has observed, in those conditions, from anyone. The conference room was quiet. Rachel looked at the table. She looked at her hands. He also said, Nathan added, with a slight shift in tone that was as close to humor as Nathan Cole got in a professional context, that the NPA deployment was the fastest he's ever clocked, and he's been keeping track for longer than he'd like to admit. A small, involuntary sound moved through the room that was not quite laughter but was adjacent to it. Rachel looked up. "Tell him," she said, "that he kept his breathing rate under 22 through 40 meters of tunnel walking with a lower abdominal injury, which is also the fastest I've clocked." Nathan's expression did the thing that was almost a smile. After, the room emptied gradually. Orland departing with his leather portfolio, the board members with their handshakes and schedules, Carver with her phone already in hand, and three other problems visibly waiting. Drummond made a brief, genuine effort at conversation that Rachel received with more graciousness than she'd given him in their previous exchange, because the situation had moved and so had he, and she was not interested in holding positions that no longer fit the geography. Nathan stayed. They stood in the emptying conference room, her and Nathan, with the fluorescent light and the view of the parking structure and the table that still had the arrangement of water glasses from the meeting. "Varys cleared the secure facility transfer yesterday," he said. "He's in Virginia. Recovery timeline is 8 to 12 weeks, then a decision about return to operational status." "What does he want to do?" "Go back," Nathan said, without hesitation. "He's the kind of person who goes back." He looked at her. "You understand that?" She did. "The consulting role," he said. "Moss's offer. You've decided?" "Yes." He waited. "I'll take it," she said, part-time, parallel to the hospital position. "The documentation work, the record review for personnel who were affected by Wole's irregularities. There are people out there carrying the wrong version of events, and someone needs to go through those files." She paused. "I know what that costs. I'm a reasonable choice for it." Nathan looked at her for a moment. "You could have said no to all of it," he said, "gone back to nights, and let the federal process be the federal process." "I know. Why didn't you?" Rachel thought about the honest answer, which was not a simple one. She thought about the night in Bay 7 and the specific silence that had told her a man wasn't breathing, and the way her body had moved before her reasoning caught up, and what that meant about the person she actually was, regardless of the person she'd been trying to be for 6 years. She thought about Donna holding the floor through 48 hours of institutional chaos. She thought about Osei, the resident, and the way she'd absorbed Sloane's public diminishment with the survival instinct of someone who understood the cost of visible dissent and was still paying it. She thought about the nurses who had walked into HR at 6 in the morning 8 days ago, one by one, to report things they'd been carrying in silence because they hadn't believed it would matter. It mattered now. That was the thing. Not because Rachel had performed an act of heroism, or because the federal investigation had handed the institution a reason to reform itself, or because the board had decided that a documented espionage incident on their third floor was a good moment to audit their internal conduct policies. Those were the mechanisms. The thing itself was older and simpler. It mattered because someone had decided not to be invisible. "Because being quiet wasn't the same as being gone," she said. "I thought I could be small enough that nothing could use me again. But small doesn't protect anything. It just makes the damage quieter." Nathan looked at her steadily. "Yeah," he said, quietly, like a person confirming something they'd already known. He left shortly after. She stood at the conference room window and watched the parking structure for a moment. The same view she'd been looking at since the first morning, when the oblique yellow light had sat on the floor between her and the conversation that had started to unravel 6 years of carefully maintained smallness. The structure looked ordinary in daylight. Concrete and vehicles and the covered bridge that had been a vulnerability and then an escape route and was now just a pedestrian walkway again, connecting 2 buildings in a mid-tier hospital in northeastern Pennsylvania. She went back to the floor. The weeks that followed were not dramatic. This is the part that doesn't make it into the stories people tell. The after, which is not a single moment of vindication, but a gradual, imperfect, sometimes tedious process of reconstruction. Rachel took the director role formally on the 1st of December, which meant she split her time between patient care and the new administrative work of reviewing protocols that had been written in different decades by people with different information and had calcified into procedure through institutional inertia rather than evidence. She was not gentle about it. She didn't need to be, and she wasn't interested in performing a gentleness she didn't feel. The protocols got rewritten with the specific attention of someone who had once needed them to be better and now had the authority to make them so. The nursing staff noticed. Not all at once, not in a single transformative moment. The noticing happened the way real change happens, incrementally, through small accumulations of evidence. A protocol that now had a clear escalation path instead of an ambiguous gray zone. A charge nurse briefing that included a section on clinical judgment versus procedural compliance, written in language that didn't treat those things as opposites. A monthly case review where junior nurses were asked to present their assessments first, before any physician in the room spoke, which was a structural change that cost nothing except the comfort of people who had benefited from speaking first. Sloan's conduct review concluded in the third week of December. His attending privileges at Garfield Voss were terminated. The documentation was thorough enough that his ability to seek a comparable position elsewhere without disclosure was limited in the specific procedurally managed way that such limitations work. Not a guarantee, but a constraint, a thing that would follow him into the next conversation and require him to account for it. He had hired an attorney, and the attorney had made representations, but the representations were running against a staff report that now contained statements from 14 nurses and 3 residents, and the weight of that record was not something legal strategy could fully absorb. Rachel did not feel triumphant about it. She felt something more like resolved, finished, a wound cleaned and properly dressed so it could close on its terms rather than the wrong ones. The federal investigation moved at its own pace, which was slow and would continue to be slow. The deputy undersecretary was named in a congressional inquiry in January, which produced a news cycle that lasted 4 days and resulted in a leave of administrative absence that was described by the relevant communications office as voluntary. Whether it would become something more consequential was a question the process would answer in its own time. Rachel tracked it without urgency, the way you track weather in a region you no longer live in, aware, interested, no longer personally rained on. Vera sent her a message in February, through Nathan, because he was still in a context where direct digital communication was managed carefully. The message was brief. Cleared for return to operational status. Going back. Wanted you to know. And below that, a sentence she read twice. The record shows what happened. Thought it might matter to hear it from me. It did. The consulting work for Moss's office started in January, 2 days a month, initially, reviewing files, sitting with people whose service records carried the same specific distortion that hers had. People who had left or been pushed or had quietly restructured their lives around the wrong version of themselves. Some of them were angry. Some of them were past anger and had arrived somewhere flatter and more difficult. Some of them received the corrected record with the same complicated non-relief she'd experienced. The truth arriving too late to undo the years it had displaced, but still true, still worth having. She sat with them in conference rooms in federal facilities and said what she could say, and did not try to make it neater than it was. She was good at this, not because she was trained for it, but because she had been it, and that was a different and less transferable qualification that turned out, in practice, to be the only one that mattered. On a Thursday evening in late February, Rachel was finishing a shift, a long one, a trauma case that had come in at 4 and taken 3 hours to stabilize, followed by the paperwork that always followed the hours that cost the most, when she stopped in the corridor outside Bay 7. The bay was occupied. A man in his 60s with a fractured wrist and a mild concussion, waiting for imaging results, reading something on his phone with the determined patience of a person who had decided to manage the wait by ignoring it. Unremarkable. Ordinary. The continuous human texture of an emergency department that never stopped receiving the people the day had broken. She looked at the bay for a moment. She thought about the night she'd stopped in this exact corridor and looked through the gap in the curtain and heard the wrong silence. She thought about everything that had come after that. The NPA deployed in 40 seconds. The suspension notice at 7:14 a.m. The diner on Calloway Street with the bad coffee and the thick cups. The text message with 4 words. The tunnel and the elevator and the conference room and the corrected record and the name spoken on a blocked line in an empty bay. She thought about what it had cost. She thought about what it had been worth. She thought honestly that the accounting was still incomplete and would probably remain so because some things don't resolve cleanly into a final number. They just become part of the structure you carry forward, lighter over time, but present. A young nurse named Yara, 3 months into her first ER rotation, stopped in the corridor behind her. Hayes, Yara said. The imaging result came back on bay 7. You want me to... I'll take it, Rachel said. She turned from the bay. She took the tablet Yara offered. She looked at the result. Good news, she said, and went in. Yara watched her go. Watched the unhurried, specific way she moved into that room, the way she introduced herself to the patient without the formal overclarity some nurses used, and without the absent efficiency of the ones who'd been doing it too long, just directly. As one person to another, here's what I can tell you. Here's what we do next. Later, when the shift ended and the floor was turning over to nights, and the elevator was crowded with the outgoing staff, Yara told a colleague something she'd observed, not as a story, just as a thing she'd noticed. She said, if Rachel's on shift, I don't worry about the hard ones. The colleague nodded, not because it was remarkable, but because it wasn't. Because it was simply true in the way that things become true when they've been demonstrated enough times to stop requiring explanation. Rachel, in the elevator, heard none of it. She was reviewing the next patient file, already thinking about what the numbers meant and what they required and how to get from the current state to the better one, which is the only direction that ever mattered. She had spent 6 years trying to be invisible. 6 years of deliberate smallness, of careful minimum footprint, of a life built around the project of causing as little disturbance as possible in a world she'd decided she'd already damaged enough. She had done it with discipline and consistency. And it had been, in its own way, a form of integrity. The integrity of someone who genuinely believed they were the variable that had failed. But integrity built on a false foundation is just a well-constructed wrong answer. The truth was that she had not failed. She had been told she had failed by someone who needed that story to be true, and she had believed them because the alternative, believing that institutions could lie to you about the worst thing that had ever happened to you, in your own name, using your own record, was a thing that required a kind of trust in your own perception that grief and guilt make very hard to sustain. The things she had learned through all of it, through the bay and the suspension and the tunnel and the corrected record and the voice on the blocked line and the conference room and the slowly reconstructed floor and the consulting work and the files of people who looked like her, was this. Quiet is not the same as safe. Small is not the same as harmless. And the decision to stop being visible, to pack yourself into the minimum viable shape and stay there, does not protect the world from you. It just removes you from the places where you could have helped. The people who needed protecting in Bay 7 on a Tuesday night in November had needed someone who knew what the wrong silence sounded like. And the only person in that corridor who knew was the one who had spent 6 years trying to forget she did. She hadn't forgotten. That was the other thing she'd learned. The knowledge doesn't leave. The hands stay steady. The assessment runs clean. Whatever you've been, whatever you've done in the places that tried to make you more than human and succeeded mostly in making you very specifically human, it stays. It doesn't go away when you want it to, and it doesn't stay away when it's needed. She stepped off the elevator into the main lobby. The night shift was beginning. She could feel the tempo shift in the building, the particular quality of an institution resettling into the less supervised hours. The staff who'd been there all day handing things off to the ones arriving with the fresh, slightly braced attention of people who know what nights can produce. She pushed through the exit door. The February air was cold and clear in a way that Pennsylvania in late winter can be, stripped of ambiguity, just the flat, honest fact of temperature and sky. She stopped on the sidewalk and breathed it in, not dramatically, not with the weight of a person marking a moment, just because it was cold and she'd been inside for 9 hours and the air was there. She walked to her car. She drove home through Dunmore with its particular skyline of industrial compromise and residential persistence. The city that was not the city anyone chose, but that had turned out, like most places people actually live, to be complicated and sufficient. In her apartment, she made tea. She sat at the kitchen table. The same table, the same 2 chairs, the same bookshelves with the same medical references, the same accumulated paperwork from a previous life she'd carefully never thrown away, which was its own kind of knowledge, maybe. The refusal to discard even the version of yourself you were trying to leave behind. She had an email from Moss's office about the February case review. She had a message from Donna about a scheduling gap in March. She had a note from the board chair about the quarterly protocol review presentation. She had a text from Nathan, sent an hour ago, that said only, Vera says the NPA record still stands. He timed someone last week. Not close. She read it twice. She typed back, "Tell him to keep trying." She put the phone down. She drank her tea. Here's what she knew. Sitting at that table in the quiet of a February night in Dunmore, Pennsylvania, after everything, the people who diminish you are not usually monsters. They're usually just people who need you to be smaller than you are, because your full-size inconvenience is something they've arranged. They'll use institutional language and professional authority and the genuine power of a paycheck, or a credential, or a signature on a form. They'll make it feel like process. They'll make it feel like your fault. They'll do it in good faith half the time, which is the part that's hardest to explain to people who've never experienced it, that harm doesn't require malice to be real. And the answer, not the satisfying movie answer, the actual one, is not to become smaller. The answer is to know what you know, to trust what your hands know how to do, to walk into the bay when the monitors are lying and the silence is wrong, even when you're not assigned to it, even when the person with the authority is about to tell you to stop, even when the easier choice is to keep walking and let someone else's certainty override your own. Because the worst thing is not the suspension or the complaint or the 6 years of being wrong about yourself. The worst thing is the 47-year-old construction worker with a blocked airway at 11:47 p.m. while everyone around him chases louder emergencies. And nobody stops because nobody thought the quiet woman with the mop had anything worth listening to. She had stopped. He was breathing. That was where it started. It was also, she had come to understand, where it always started. Not in the dramatic reversals or the federal proceedings or the conference rooms with the formal language and the leather portfolios. In the moment when someone who has been told to be nothing decides, for one patient, in one corridor, on one specific night, to be exactly what they actually are. The rest is just what happens when that decision turns out to be right. She finished her tea. She went to bed. She slept without difficulty, which was not something she'd been able to say for most of the last 6 years. And if it wasn't every night going forward, if there were still nights when the wrong silence came back and the hands that were supposed to stay steady felt like someone else's. That was the human version, the honest version, and she had finally stopped needing the other kind. Tomorrow she would go back to the floor. The supply carts would be stocked by someone else now, which still felt slightly wrong, but she was adjusting. The protocols would continue to be rewritten. The files in Moss's office would continue to be reviewed. The floor's junior nurses would continue to learn, slowly, that their assessments were being listened to. And somewhere in Virginia, a man with a healing lower abdominal injury was timing his colleagues with a stopwatch and telling them they weren't close yet. She had not saved him because she was extraordinary. She had saved him because she was paying attention when no one else was, and she had refused to let their inattention set the ceiling for what was possible. That is the thing no one tells you about the quiet people. They hear everything.